All right. Thanks for coming on. Why don't you introduce yourself and tell me a little bit about who you are and what you're doing.
Okay, so tell me how many minutes you want that to be?
As many as it needs to take, because I want you to be truthful and honest. Because we just met too, so right. I know what you do.
Yes. Okay.
But what I like to do is really dive into who you are here.
Okay, good.
In live time.
Yeah. All right. Very good. Well, thank you, Tom, for having me here on the No Bad Dogs podcast. I am Dr. Ava Frick, as you know. But at any rate, I grew up in Missouri, and I've been a veterinarian since 1980. My life was on a farm, so I've had a lot of exposure to all kinds of animals and gardening and all that kind of thing. Was in 4-H, and ever since actually that I was 3, I can remember my whole focus was to be a veterinarian. There never was a time when I had to decide, what am I going to be? What am I going to do? It was just there. And so everything was focused towards getting to college, taking the right classes, getting into vet school, and then being this veterinarian who took the oath to, above all, do no harm and to provide for the animals the best that I could. So that puts on me a responsibility to always be asking the question, if something isn't working, why is this not right? So 1980, I started as a traditional veterinarian, worked my first year in Kansas, Mission, Kansas area, and then out to Arizona. I was in Phoenix, worked a lot with the Arizona Humane Society, and developed a big understanding about overpopulation and all of the travails of that, and continued on. Ended up, after 7 years there, moved back to Missouri, so I wanted a bigger clinic, I wanted more acreage, I wanted horses, and my family's there with farms and everything, so it was just going to be a lot easier to do all of that. So continued the traditional practice, and then I had I was playing some women's soccer, and got body blasted from the side and down on the ground, and I could hardly get up. I was like crooked. The next morning I was still crooked, so I went to the doctor, who happened to be a DO, which I didn't realize at that point what a DO could do. But basically, he adjusted me. And it's like, that guy's Jesus, because I walked in bent over, and I walk out standing up. And it's like,
what's a DO? Is that
Doctor of Osteopathy.
Okay.
So earlier on, and I'm not sure if all the osteopathic colleges now teach manipulation and body contour and get into the details of musculoskeletal. But in the early days, a DO college, you would come out as a medical doctor, as a DO, but you had all of this other skill and the abilities to adjust bodies just like chiropractors do. So it went very deep into osteopathy and all of that. So yeah, that was my real first exposure to chiropractic, and that was probably in about 1988 or 89, something like that.
Wow.
And then so I was around 39 years old or something like this. This would have been in like 96. This one day I had a dog come in, a dachshund, and it's up on the table. Of course, it can't walk. And I looked at the dog that day. Of course, I'd seen a bunch of these in the past. I looked at the dog that day and I thought, well, I can give you some drugs, but I can't fix your problem. And that's when I decided I needed to learn more on how to fix problems. And it was a turning point in my life, because that's also when I'd had a son. And so as a parent, you start looking at how am I going to be the best for my child, too. So all of this kind of happened at the same time frame. So Hillsdale, Illinois was the only chiropractic college for animals where you would learn animal chiropractic at that time. So I went to Hillsdale, Illinois, and got my certification by the American Veterinary Chiropractic Association. And a part of that then was looking at pain. So as soon as I got all my certification done, I wanted more, like, how can I help pain in dogs? It was a big deal. And at that time, this is in the late 90s, we had prednisone, the steroids. We had phenylbutazone, bute, which is commonly still used in horses, but not dogs anymore. And Rimadyl had just come out on the market. But those were really the only 3 things we had for pain. So if you think about all that time prior to that, dogs that went through surgeries, had broken legs, orthopedics, whatever, lung surgeries, they had really, I mean, it wasn't even in the veterinarian's mindset. You weren't taught it. You didn't think about postoperative pain. What is that animal feeling? You didn't even think. I mean, like, once you've been on the surgical table and you've had it happen to you, you start thinking, what about this? Do they not feel that too? But because they don't speak it, however, you know that they talk to us all the time in their body language, the size of their pupils, the position of their eyes, where their ears are, their body posture, the hair, the tail. There's all those signals they give us that says, I'm very uncomfortable and I'm in pain. But at that point, veterinarians were just like oblivious to it still. So I had to go to human physical therapy conferences. So I started going to PT conferences to find out what did they have for pain that I could apply to animals.
And what was, can I ask this?
Yeah.
What was the dachshund? What was it that you saw that you knew that you couldn't fix? It had to be like pain management through meds. Like when the dachshund was on the table, what was it specifically that you?
Paresis, rear legs weren't working. It couldn't bring its legs. It couldn't stand. It was a disc protrusion.
Okay.
Or something like that up along the spinal cord. So the spinal cord itself had been compromised to a degree that the nerve signals weren't making it all the way from the brain to the feet, and then from the feet to the brain and back and forth.
Okay.
Yeah.
Okay.
So that becomes, when it's in that breed, those short-legged, long-bodied, brachycephalic type of dogs, when that happens in them, then it becomes chronic. It's usually not just it happened once and that's the end of it. It's usually going to be perpetual. And so there are a lot of reasons that can come about, from their conformation and their age and diet and all those kinds of things.
Can you explain? I feel like conformation is going to come up a lot in this conversation. Can you explain, like in your opinion, like what conformation would mean? Because when I hear conformation as a dog person, I'm hearing conformation in like show dogs and how they stand and their posture and their statue. But can you give me a breakdown on conformation?
Yeah. So conformation would be what that dog in its genes was born with, the characteristics that's going to create the leg length in the dog, the angle of the dog's legs. So you have the straight-legged in the rear versus, and some breeds are a little more straight-legged, like Chow Chows are a little more straight-legged in the rear, but other dogs have more angulation. So that's part of that conformation. So the conformation can also be that nice square box type, where they're that, versus a body that's longer in the spine. And there are some within a breed that could have a longer spine than the shorter. But the conformation has to do more with the breed type.
Okay.
Versus posture can change throughout an individual's life. And posture affects what appears to be the conformation, but the conformation is what was already there. That's the innate.
That's the genetics.
That's right. The conformation of that particular breed. Versus posture would be, are they standing base narrow? Do they have their rear legs under them, their front, versus in that neutral position where they're all squared up really nice? Are they kyphotic, like the back is arched, versus lordotic? You got the sway back. That shouldn't be. You would want that nice top line for the most breeds. There's a few that'll have a little bit.
What's the deal with the? This might be comfort. Well, maybe not. What's the deal with like the German Shepherds who have that slope? Like, you know what I'm saying? Mm-hmm. Is that a
So decades ago, there was a male German Shepherd, and this is my take on it from history that I know from where I've been, that was winning awards in a lot of shows, and he had that low posture. For whatever reason that he became popular, I don't know why, but he was the one that was winning. So people then started breeding for that. Oh. Now, the downside of it, which they didn't learn for a while, was the fact that that was a sign of hip dysplasia. So this is where the problem with hip dysplasia got bred into the German Shepherds, because they were trying to replicate this low stance posture, which doesn't add for good propulsion, because moving is about all of that strength and the gluteals and the hamstrings and the quads and being able to really engage and push up. Well, they have a lot more to go against when they're creating that drive because of that low posture. So there are still some of the German Shepherds that tend to have that posture, and maybe they've bred some of the DJD, the hip dysplasia, out of them, but that's where that originally came from and created that versus a nice top line with a stronger rear end.
Wow.
And not so slung under themselves.
So they almost created the dog was winning, and then that winning created problems for decades of dogs in the future.
Yeah, if you think about how many poor dogs with a dysplasia and the poor pet owners, the owners with that trying to counter it. And then it's gotten into many, many breeds because in their shepherds that bred with Labradors that how pervasive it became because then of dogs breeding.
And I wonder why the judges at that time were like, yeah, that is going to win. That's different. You know, they didn't see it as because I feel like that could go either way. They're like, that's not the way German Shepherd. I've always wondered that, like, because my clients will come in, and I recently just had a client that lives in Nantucket. And she just was texting me like 2 days ago, and she has a German Shepherd, and he has that slope. And I was like, I don't know if that's a good thing or a bad thing. And then she had to bring him to get an MRI because it's starting to bother him and stuff.
Not a good thing. Yeah, for a lot of different reasons. You have to think about, too, though, is that the dog show industry, Conformation especially, like the horse racing industry, is very who you are and can be friend-driven, money-driven.
It's all about looks.
Yeah.
Which is an interesting.
And who can, and maybe whose friend, this is so-and-so's dog, or the handler. People pay handlers because they always win. Why are they always winning? Well, part of it is because they're good at what they do, but maybe it's also who they know.
Yeah.
So
right,
who knows way back then who was connected to who that caused this dog to start winning. But then everybody wanted to breed from him.
Yeah. Maybe it was one of those situations where they said, hey, there's this funky looking shepherd that's going to come on the table in this showing. And we want to make a lot of money off of this pedigree. Yeah. So we're going to have it win, whatever title it's going to win. Yeah. And then all of a sudden, the genes or the semen from that dog just goes straight up. And then now everyone gets paid. And then now, whatever, how long ago that was, like, oh, shit, maybe. It's like the guy who invented the doodle, I think, is now regretting inventing the doodle or something. Yeah. It's probably one of those things.
Well, they say that one even. I say, so the dog's mind, and I know you know this, and you train this way, the dog's mind is the dog. And when they are bred for a purpose, like a hunting dog, to not allow that bird dog to go hunt birds, or to have a border collie that cannot do its job that it's been trained for thousands of years, hundreds and hundreds and hundreds at least, if not thousands, to not allow that mind of that dog to exercise its purpose is a really sad thing. And so now you've taken a Labrador, which has a certain conformation. I like that old style Labrador, those stocky, nice, square.
More like an English lab, you think?
Yeah, those older ones with the short, stocky tail, and they got that great body.
I do too.
Squareness. Not that, when they started doing the field trial Labradors, they were breeding them for hire. And a lot of those then got the straighter rear legs, which has created a lot of the hip problems that those field trial Labradors have. But anyway, so you take the Labrador, which is bred for a purpose, a retriever, and its mindset and its job. And then they've crossbred them with which I love poodles, standard poodle, which is a totally different body conformation. Yeah. A totally different job that it's been trained for. Totally different. If like the chest is different, the width is different, their whole makeup, and I do a lot of Ayurveda, which is India philosophy, and they have the doshas, the Vata Pitta Kapha, and all of that indicates and drives certain mechanisms and lifestyles and mindsets and diseases and conditions and where the body will gravitate towards in life and how you help them. So that now they've mixed those two up, which they're two totally different makeups, the MO, the mindset, the job, the performance, the drive is all different.
Yeah.
And now you've got this other one, which no doubt they're cute, but they have to now somehow prioritize, organize, who am I? They live in a state of who am I?
Yeah, and a lot of them are going to pet homes, and I think they were originally, a lot of people get them because they're hypoallergenic. I believe that's the reason. But I would agree, like a lot of people don't realize that the poodle in that dog is actually a high class working dog. I remember there was one episode of you remember Duck Dynasty?
Oh gosh, they are so funny. I love
So
that.
funny.
The first one I got into was when they had their water park.
Oh, I didn't
Remember
see that one.
Oh my
No, I
gosh,
didn't
they
see
got a
that one.
pond and then they get a big old crane and they got a tire hooked to the crane and the water park one. It is hilarious. All the stuff.
That's funny. Yeah, I could imagine that because I couldn't imagine them doing like a traditional water park. They'd have to do it in the mud somewhere.
Out in a pond with all
Yeah.
their equipment and all. Oh yeah, it's super funny.
That
It's a great
family's
one.
funny.
Yeah.
But one of the episodes, I think it was Cy, they were all bird hunting, and they all had, I think, labs or goldens or whatever, and Cy showed up with the poodle, and it was like a competition. And they said, "Psh, what are you going to do with that?" And the poodle was all cut up like like a
with the palms.
yes,
Got the wrist
and the
and
head.
tail.
Yes, it was so funny. So Uncle Cy shows up with this poodle, all done up, all foo-foo like, and all the other guys are picking on him and stuff, and Cy's like, whatever, I'll show you. And that poodle outperformed every lab, every field line golden. And that's why I was like, whoa. And I really started I knew that they were working dogs, but that was a real cool test. If
Yeah.
anybody hasn't seen that, you could probably just go on YouTube and check it
Find
out.
it,
It's
yeah.
really funny. So that poodle outperformed every retriever on the line. But anyway, so, all right, let's get back to your kind of your story. So after you started going to conferences for human chiropractic and PT.
Physical therapy.
Yeah,
Yep.
and then what?
To find pain. Yeah, so that took me into creating. So I was on the first group of PTs and veterinarians to start the whole animal rehabilitation revolution.
Cool.
Yeah, and then it wasn't too many years after that. 2001, I decided, it was one day I'm doing surgery, and I love doing surgeries. I was a really good surgeon. And I got to the end, and I did my last knot, and I laid down the forceps and the needle holders, and I go, okay, that's as many as I got to do. So I sold my traditional practice and then built the Animal Fitness Center, the animal rehab, Missouri's first full-service veterinary animal rehab with the underwater treadmill and all the bells and whistles and everything. So
Wow.
I've done rehab. So big into physiotherapy and with that exercise conformation posture. So we were talking about posture, the alterations that can come to that conformation
Yeah.
because of weak hips, because of injuries that haven't been rehabbed and worked through, because of other like congenital or genetic related diseases like the OCDs, the lesions in the shoulders of the dogs or the elbows of the dogs, those kinds of things that then can affect where they position their legs. And then there's also things that can affect posture, like poor fitting harnesses. I don't know where you're at with I know you've got the deal that there's owners that you can train that are really good, that then they're going to have a good dog, and other owners that you work at training to help that dog, and the dog does great for you, but the owners are not the ones that are going to follow through really well so that the dog doesn't even need a collar or a leash. But there are many, many, many people out there that are going to use harnesses because the dog isn't trained. They pull on their neck, which is, I'd rather have a prong collar and they don't pull at all than a regular collar, prong collar, versus a regular collar that they're pulling on so hard that it's affecting the esophagus and the trachea. A prong collar, they just okay. But there's a lot of people that are against those, I know too. But at any rate, I never got to the point my dog was so good I didn't need it.
Yeah.
Some of them are so strong, anyway, especially when they have a purpose, like a hunting dog.
That's right.
My son has coon hounds.
Oh, I was just gonna say hounds are.
Yeah.
When we get an inquiry, it happens like 2 or 3 times a year because a lot of people just kind of they know what they're getting and they don't, And when we get hounds, we just have a conversation with them. We're like,
Yeah.
listen, these dogs are not meant to walk nicely on the leash. They're not
Exactly.
meant to be good pets. They're meant to, they love sleeping outside and hunting stuff.
Yeah, yeah.
So,
Yeah, anything that's fuzzy and woolly. So I came home a year ago because I was living in Arizona and I had to come back to Missouri. I had no winter coats. This was in January. I had to call Eddie Bauer, like, I need an overnight coat. And I got this thing that has the fluff around the
yeah.
hood.
Yeah.
So I get to Missouri, and my son's got these coonhounds, and they do actually. Some of them love being in the house and having the sofa, but that doesn't mean they won't chase something as soon as they get out, you know? But anyway, so I flopped the coat down. The next thing you know, the one hound's got that because of that fluff on he'd ripped the hood off of the coat, and he's like
Thank you very much.
killing the hood.
Yep.
Oh, shoot, they're funny. But anyway, yeah, so a lot of people are going to have harnesses. And there are more poor-fitting harnesses out there. I do a whole program on harness fitting. And the packages that are on the shelf, terrible pictures of harnesses that go in front of the front leg, across that shoulder joint. Every time that leg goes to move, it's told you can't go that far. You can't reach that far. So now the leg begins to not go that far. However, because the brain told the leg you need to reach this far, it thinks it gave it that message. So now it starts getting confused messages about the position of how far the leg moved. Now, if the front leg doesn't move right, and now over time it's not extending as it should, the contralateral back leg is also getting a signal because all of these connect. And so it's getting a signal, you can't go that far, you can't do that much. So harnesses across the front, bad deal. And there are many of them out there, and the dogs are trying to walk and they can't. And then also the harnesses that have the clips in the front. When that dog's walking, their whole torso is constantly in a shift to the direction that that's pulled up. So now their rib cage is changed, as well as the fact that the skin layers and the fascia and all kinds of fluids and nerve signals move through that fascia. So that is being distorted and changes the posture over time. That dog's whole rib cage can shift. Just like musicians, kids that play instruments as young and continue to play and play and play, you actually deform your hands, fingers, because of that constant positioning of that instrument. And that'll happen to those dogs over time. Now that is a posture distortion, but the conformation wasn't that way to begin with, you see.
Yep.
The difference between conformation and posture is how you are now. So somebody that sits at a keyboard and becomes very slumped over.
Yeah.
Surgeons, veterinary surgeons, you have to work at thinking yourself out of that posture. Or somebody that doesn't stand with their body upright, or people that get overweight and their back is curved because their abdomen is so far forward.
Yeah.
They don't complain about the fact that they can't bend over to tie their shoes, or they don't even see their feet. They complain about their back hurting. Well, if you don't have strong abdominal muscles, you're going to have weak back muscles, and you'll see dogs that are lordotic and their bellies are distended. Now, maybe the belly got big because they have an adrenal gland problem and Cushing's or too much steroids and that, or muscle weakness because of eating kibble in the bag that doesn't really have good protein. And now they've gotten older, and because of years of not the right volume of amino acids or enough variety of the correct, if you always eat chicken, you're not getting every amino acid.
Right.
So over time, the muscle gets weak, and then that can happen too. So we can see it in dogs, but that is also posture, not true conformation. It's not their conformation. It's the posture that's developed because of a life of whatever it was, injuries or poor harnesses or bad fit for women, wearing shoes that are too tight.
Yeah, and like
And
narrow.
and squeezes the foot. I mean, like horses, everything starts at the hoof. The feet are very, very important. Even like for the dogs, the long toenails, how that affects those long nails cause those toes then to push up. As those toes become pushed up, so many proprioceptors in those digits send signals to the brain to tell the body where it is in space. And so when that's not happening, you don't have that nice little spring there.
Yeah.
And it's rigid. You're not getting the same signal to the brain about where the body is. Now you get animals that can't calculate going up a step if you're doing exercises with them and you want them to step up, they could have missed signals over time because of that. And then the second thing is, as this goes on, then they start to drop in their fetlocks. They have to change the posture, the normal posture of their foot,
Right.
to accommodate for this chronic long toenail and the distortion that's happened to the digits. So now they're down in the fetlocks, the feet start to drop. And that can happen, that becomes then the ones on the plantar surface, the back side, they all become longer. And then the ligaments, tendons on the front side become shorter. And so now that also affects how they're going to be able to pick up that. Everything's connected, like, the shin bone's connected to the knee bone. So as those toes are affected, the hock is affected, the stifle's affected, the hip is affected. The pelvis shifts to change, to accommodate. This is all posture, but that's all going to interfere with a dog being able to sit comfortably, to get up on the sofa, to do a stare, to turn even on a signal, and to hold that position comfortably. And then everything from the rear shifts to the front. And then you'll see over time, I had Shiba Inu come in just 2 days ago.
God bless. Shibas are funny dogs, man.
Well, but if you think about, this goes back to their heritage. Where have they lived for thousands and thousands of years? Those dogs are good in the culture where they are because it is this very reserved.
Yeah.
It's not that old hug me, come and give me one of those nookie kind of lifestyles. It's
a cat dog.
Your posture, your position in life and how you stand. And you kind of keep your distance. You're kind of to yourself. You're respectful. But you could be a samurai in any second. And
Yeah,
a
man.
lot of Shih Tzus got that I'm a samurai coming out thing. This one, she's really, really friendly. But at any rate, they were saying they thought she was overweight. I said, and she had a knee problem a couple years ago, and now she's lame on the other leg. And so I'm looking at that, and I'm watching her walk, and she's got a hitch, and I'm looking at her and then saying, well, okay, two things. She's got a really, really thick coat. I said, if she's a short-haired dog, you wouldn't be thinking she was as overweight as she is. But the other thing is that she has, because of the chronicity of the uncomfortable status of her rear end, she's been shifting more weight to the front. So normally they carry 60% of their weight on the front and 40% in the rear. And that would create, with their normal conformation, a good posture.
Right.
When you have pain in the rear, because it hurts to get up, they start pulling from the front. Because it hurts to go uphill, because that loads to the rear, they're going to try to pull more from the front. Now they start carrying more than 60% of the weight on the front. So they'll carry 70%. I've even seen dogs with 80% on the front. Those ones where when they go to sit down, you see them shift to the front and they kind of lower themselves, but none of it's really on the rear end. It's like an 80-20. So when that happens, that front end gets bigger, because they're opening up their legs, they're opening up their chest, they're shifting this weight. So this particular Shiba Inu, which is really not, like a pound maybe overweight or something like that, but she looks big because her front end's gotten bigger.
Yeah.
Because she's carrying more weight on the front. And
So her muscles are bigger, or what do you mean?
Yeah, her chest has gotten wider, yes, and the muscle tone in her front legs, the tonicity, at least, of that front end is more solid, rigid, because it's doing more of the holding of the body.
Okay.
And then, of course, as that front end starts getting weaker, that's when the dogs have more problems. She's not that old yet, but that'll eventually happen if you don't correct this, which is what we're working on now, is chiropractically helping her, correcting the subluxations, correcting the misalignments of the tibia, the fibula, the legs, as a chiropractic physician, not just addressing the spine, but also going into the joints.
I'm so happy that you came on. This is so fascinating to me. I'm really liking this, because this is like checking all the boxes off for me of like what I'm always, I wonder, So one thing I want to touch on again is the harnesses, because I saw this one diagram, possibly video, I can't remember, where they did like this. You know how you can like scan a body and see like where the temperature of the body is, or whatever?
Thermography.
Yeah, so they did this. It was like that, but it was for pressure.
Sure.
So they did this test on dogs who wear harnesses, and what it does, it was talking about how dogs who pull really hard, because here's the problem dog owners have, and I have so much empathy and understanding why all this happens. I just so happen to not recommend harnesses because, like we're talking about, dog owners are trying to. I primarily am like a reactivity behavioral modification person, so I primarily deal with a disconnect between dog and owner. And once I see a dog pulling their owner around town, pulling their owner through the door, pulling their owner upstairs, I make every decision. I want to do what I want. And there's not one single time the dog goes, "Hey, is this okay?"
Yeah.
And so I typically don't recommend harnesses because the dog is never engaged, the dog never checks in, and then the owner wonders why the dog A isn't listening, but B is now protective over the owner, is anxious over the owner. And so that's the main reason. Then I try to explain to people that harnesses, going back to this diagram, the dogs were pulling so hard that it was pulling to a force to a point where the dog was actually, it was causing pressure on the internal organs of the animal.
Yeah.
And that's where I was like, holy crap. And then it started talking about some of those, the harness up front where it was taking, I think this is what you were talking about. You have obviously a much better idea of how the animal works, but they're taking the elbows because some harnesses, improperly fit harnesses will come down almost to the elbows. I can't remember what they're called, but it would come down to the elbows, right? Where it's hanging down, where maybe it's supposed to be under the chest or something. And now when the dog pulls, it pulls their elbows in. And some dogs are pulling so hard that it's pulling the elbows in, but then it's also pushing against the organs of the dog.
Yeah.
And so on the surface, the dog isn't showing any discomfort. Why does that happen?
So do that again. Exactly. Just now. Okay. Now, so you're thinking about the elbows.
Yes.
But what did that do to your scapulas?
Opened them up like.
Yes, at the top. So you've pulled your glenohumeral joints, the shoulder joint. Those have come down and in, but your scapulas have moved up.
Yeah.
Now, a lot of those same harnesses have this clip that comes up and really tight, like you said, and clips right there over those scapulas.
Yeah.
And right in between your scapulas are major acupressure points for the liver.
Oh, shoot.
Yeah. Oh, shoot. So you've got this going up with this really hard clip compressing where your body wants to open up those scapulas because what it's done with the elbows, and I'll get back to the elbows. But that can't even work right because you've got this harness clip so tight, and I've had them where you unclip it, and it's imprinted in the dog's body. And I go, how many hours a day do they wear this? You know, it's like,
wow.
Yeah. And then the other thing on that aspect, where it's clipped really tight there, and these can't go this way, the other thing when they're like that is the rib cage can't expand.
Yeah.
So you're out walking this dog, and it's breathing faster because you're exercising, but the rib cage can't inflate the lungs, so you get these little teeny breaths. Now you do that with a brachycephalic dog, a short-nosed, poor breathing anyway, in the summer when it's humid.
Talking about you, Frenchies.
Yes, that's right. We are talking about you, Frenchies. Yeah, I mean, like that is like super hard on those dogs who already have respiratory problems.
Yeah.
Now this whole elbow deal that you've got.
Yeah.
So the elbows now are impinged, kind of back to what I was saying, where all of the signaling is not going to be correct on where that leg placement can go. And then the elbows being tight is going to further impinge on the ability of the rib cage to expand. So everywhere along there, and we'll eventually get to the chiropractic part, but there are all of those joints and those areas between the ribs. Have you ever had a rib out?
No.
Oh my gosh, it is painful. It is really, when a rib, because the ribs come down as bone and then there's a cartilage section of the ribs. And you can have ribs that'll subluxate either up where it's attached to the vertebra or further down. And so when that happens, it's hard to inhale. It'll wake you up at night if you happen to move wrong.
Uncomfortable, yeah.
Yeah, I first did mine. You try to be a good person for the environment, and I had a trash can, and there was some recycle that was in the one that was for trash. Of course, it was down towards the bottom, so I go, okay. I couldn't leave it in there, so I was going to have to put it in so I reach over, and I'm 5'7.5" and got long legs and long arms. Well, as I reached over the top of that, it hooked onto my rib cage and popped the rib, and instantly it's like, oh my gosh, this is painful. But that can happen to the dogs. And so that causes their ribs to not, they'll be bowed on one side, which you can like look down over the top of them. You want slab of ribs. Their rib cage should come along and just be smooth and kind of flat. And you'll see them on the other side. It's all rounded and bowed and they're tender there. And they wonder why when they touch them that they move away from them, or they get grumpy with others, or you go to, just like a horse, you go to saddle them up. And they know it's going to hurt. And they side pass, their tail gets swishing, their ears are flicking, they turn around and look at you. They talk to us all the time. People just don't pay attention to how much conversation the dogs and horses and animals actually give you until, like you in your field, where all of that is very crucial to understanding the mind of the animal.
Yeah, and I find too, as you were saying that, what ends up happening, it's such a good point, because if you take what you're saying about the dog's breathing, of course that's connected to the behavior. Because I deal with reactive dogs. So now I have this reactive dog that's breathing like this. So then, of course, just like with us, if we started breathing like that, our nervous system is going to go, "What's wrong?
Exactly.
What's happening?"
That's right.
So it kind of exacerbates that whole problem and compounds it to make it worse.
Exactly.
Where the dog can't take these breaths as comfortable, or if they've been trained by this constriction not to do it. And so now they're in this constant like fight or flight rhythmic pattern of the breathing. And that's why, it's interesting, because I my passion is education, which is why this podcast is so cool, because I get to go beyond training. But the other thing is I just try to tell people, like, look, the prong collar is a safer tool for your dog. You put it right behind the ears where all that muscle is. You fit it nice and properly, and your dog gives into that pressure, and they go, "Okay, I'm just going to stay here." And then you can teach the dog the heel and the behaviors, and then pretty soon you don't need the prong collar.
Right.
But it just goes against what it looks like, because you would assume slapping on a harness and letting a dog drag you down. And I tell people, it's not only that people are like, "My dog's pulling me." I'm like, that's the least of your worries, because now you've just told your dog your relationship is so disconnected that your dog won't even look at you because you haven't. So it's interesting. I'm glad that you had brought that up. I didn't know we were even going to get into that, but I'm glad that you brought it up, because I try to tell people all the time, like how dissolving the harnesses can be. But I get it. Like, you go to any pet store and that's what they have and that's what they sell. And I totally understand why it happens, and it makes sense to a dog owner. Think about your 21 to 30-year-old dog owner who has a dog that pulls around. They love their dog. They probably have their Instagram account for their dog and all that stuff, and that's great. So that's my demographic, really. Then they go, "My dog's pulling me around," and they're choking. They keep choking themselves on their flat collar, or even their martingale if they're lucky, and then they get a harness, and now the dog isn't choking. But two things are happening. Well, everything you just said about all that, right? But then also you're disconnecting from your dog. So it's much more than just why the harness can be damaging to the dog's structure, or posture even, but it's also disconnecting them completely. That's the number one thing when somebody comes in here with a dog, and there's a spectrum of behavior, right? I'm reactive at guys with hats. I'm reactive at other dogs, but I'm good with people. That's like the low end. And then there's dogs who have killed other dogs, has a bite history, will go after anything. It's the same underlying thing every time. The dog owner gets dragged in here, typically on a harness, and I'm like, you can't even get your dog to, if I walk out of this room and you ask your dog to sit, they're not going to do it. And you want your dog to stop behaving a certain way that they had the genetic disposition to do anyway. Because a lot of people like to get these big, scary dogs that they can't control. I got a big, scary dog, but fortunately, I have a background in training. So
he don't look scary on the video.
Good. I can keep him under my thumb. But yeah, it's just interesting. And when you were talking about that, that front chest posture, my Borbal has that huge, massive, like, he kind of like, it looks like a Mack, the Mack truck logo?
Yeah.
That's what it looks like. It's like really wide here, and then it kind of tapers off in the back.
But some breeds are that way too. It's like if that's not their innate conformation. Some of them do have. Like if you take an English Bulldog, they start out that way. They're big in the front and small in the rear.
Do you know? Can I ask you this? The English bulldogs. I found this out recently that the reason why they're so expensive is because it's a dangerous birth. Like I don't know what that would be called. Like the bitch giving birth is dangerous, but then also they only have like 1 or 2 puppies per litter. Is that right?
Yeah, they have limited numbers, and typically I've done C-sections on those, but
That's
the English bulldog people, they just schedule their dogs for C-sections. They don't even allow them to have to get to that point in delivery that
C-section.
they do
what it was.
C-sections on them all the time. And I think the most I ever had, I've had 5. I've pulled 5 out,
Wow.
but that's a lot. Now, the upside, you want to have more because the puppies have to share space in the 2 uterine horns, and usually they'll even themselves out. Like you could have 3 on one side and 2 on another, or 2 and 2. But if there's more, they're going to be smaller, which is easier delivery. If you only have 1 on each side, or 1 on one side and 2 on the other, that one didn't have to share. So he's going to be a whole lot bigger, which is harder
wow.
to push out. Yeah. So more puppies in the litter makes it easier on the mama because they're going to be born a little bit smaller.
all
That
like
doesn't mean
even.
they're runts. That just means everybody shared, and so they're not as big at birth, but you can have bigger ones. And then depending on the breed, if it happens to be one that has a larger head, then that could be harder, or if it's an early, like her first time of delivery.
Yeah, that's what it was. It was the C-section because then they have to go into the hospital for birth and all that stuff. All right, so get back to your timeline here. So where were we?
Well, first off, one thing I wanted to say too is where you're talking about the people that come in, the young people that have the dog. That I think when I see a lot of those young people, they got the dog because they wanted a friend.
Yeah,
And they wanted it to be a playmate, and so the dog really looks at them. Like in a younger home, if you had like kids that were 8, 9, and 12 with a dog, and then they had the mom and the dog has associations with everybody differently.
Right.
And the kids are the playmates, and then the mom's the one that feeds them a lot, and the dad does these things, and we got everything's cool as long as it's on schedule. We're good.
Yeah, that's right.
And so now one of these kids gets old enough, and now they want one, but they only ever were a friend to the dog. So they get the dog as another friend, which then creates that. They don't have that, as what you're talking about, being the parent and being the one that's telling the dog, okay, here's what we do. Here's what you do when you do it.
Boundaries, yeah.
Your boundaries and all that, because they never did that before. So then they end up needing your help because it wasn't there to begin with. But now you got to backtrack.
That's right.
And try to retrain.
That's right.
Which the dog is going to be willing to do it for you because you're going to present that, versus the owner. They still have to get out of their head that you're this buddy friend, and you just sit with them and hug and play.
That's right.
And they have to create the respect for order and seniority and who gives the rules, and
Just be a good leader.
yeah.
I say that all the time. Like we have, at any given time we have like 20 employees between our 2 facilities, and I say if I wasn't a good leader, things would fall apart. If they said, if I said, hey, I need you here at 9, and they show up at 10, and I say, like that's a problem.
Yes.
Like, that's a problem, because then what it's going to do is it's going to bleed in everywhere.
Yes, that's right.
Like, hey, I need you to go clean that kennel. Well, I'm going to half-ass it because he doesn't really care, and I tell people that all the time about their dogs. I said, if you ask your dog to sit, follow through, because then you just become, everything you say is optional. And then once you give a German Shepherd or a Rottweiler or a Connoisseur, so these big dogs that we typically see, optional things, they go, wait a minute.
Yeah, I got a choice.
You don't know what you're doing. Let me get that steering wheel, and then it's all over, right? And then they come in, they're barking at me, "Arr, arr, arr," and I take the leash, and they're fine with me, and the owner's like, why are they fine with you? But I'm like, because you're the problem. That's why we created No Bad Dogs.
That's right.
I always joke about, like, with my colleagues, they say, you sure there's, I go, no, listen, you can get any genetic, you can get a bad egg, right? But that's not the point. The point is if your dog is misbehaving, there's a 99% chance that it's your problem. It's your fault. So I always have that joke with my colleagues, because they're always like, they get a 10-week-old puppy that's trying to murder them, and I'm like, oh well, that's different, right?
Yeah.
Anyway, so you started getting into so when you said fitness, you said you opened up the first PT and chiropractic hospital in Missouri. You said fitness. Did you say fitness?
Yes, I called it Animal Fitness Center.
Okay, so what does that entail? Because I'm interested in that.
Well, it was all about getting the body there, but also having one who doesn't have injuries. So you could have somebody that had injuries or had a knee surgery, whatever.
TPLO or something.
TPLO. And then we're bringing them through rehab. So there's that phase. But it's also having an agility dog that doesn't appear to have any problems, but we want to make sure they still can do it.
Awesome.
Shih Tzu dog that puts their bodies through a whole lot. So enter in the chiropractic part of this is keeping those joints aligned, those motor units working correctly, such that that dog can continue to do, or finding like they're off a little bit. Okay, a little bit. A little bit for a barrel racer is a big deal. That horse can't turn a little bit, can cause that barrel to drop and you've got too many seconds at it on. It's a problem. So the same way with the dogs. If the owner, the trainer, can see those little things, then to a good chiropractic veterinarian or good animal certified chiropractor, you can correct that. There's a reason for that.
Right.
That can be changed then, and they can go back to being as good as they were, rather than going, oh, well, it's probably not that big of a deal, or I'll rest him for a few days and then see if he comes back. Well, then after a while, you compound things. So I did that and then created many, many exercises. So at that point, there's like exercises you can do for rear end issues, for spinal problems, for front legs, specific exercises for balance for the senior dogs, just like with people, where people as they get older, they don't pick their feet up as well. And if you haven't been one that lifted your legs good, then they start scooting. Well, there's a lot then that you're losing, again, in those proprioceptive messages that go from the foot when it lands up to the brain. So they start scooting. Now you start falling more, and the balance becomes more distorted. So people go for therapy. Well, there's exercises for animals, for the dogs, for the horses, specifically for that, to help improve their balance, improve their posture. You can take a dog that has the kyphosis, the rounded back, which can happen because of subluxations that we correct. But then if it's been that way for a while, the muscles have changed. So now you have muscle length distorted, and they can become short that should be longer, and other longer muscles muscles that were shorter have gotten longer, and now those muscles start to think the wrong way's the right way because they've been that way too long.
Yeah.
So we have to change all of that nerve muscle signaling, and there's a lot that can be done with massage, with lymphatics, with the fascia planes, moving the tissue. You've seen kinesio taping.
Yep.
You know, that colored taping on the horses, on people, on athletes. So we do it on dogs too. That can help move those fascial planes and then change the nerve message signaling that's getting to the brain about that area of the body.
Yeah. So
we do all that.
I had a veterinarian on, Dr. Chris Dallas. She's a holistic vet, but she also does a lot of like Chinese acupuncture. And it's really cool to see the acupuncture, like when she's working on one of like my older dogs in particular. They go in there when they get older, senior, and it's cool to just see in the beginning they're like tense and they're like kind of like, you know, nervous. And then once she starts working on the dogs and does her acupuncture, the dog just relaxes. You can kind of see the muscles just like with people.
Yeah.
It's really cool.
Yeah.
Have you dived into acupuncture at all, or is that something that you?
I've had it on myself, but I never trained in it. I do have other doctors that do that. I'll send my patients to.
Cool.
For me, I like a quick response.
Yeah.
Chiropractic's that. I like that instant gratification. Acupuncture takes a little while.
Yeah.
It doesn't just happen. Now you can see some of the changes in their,
because it's
like
blocked.
they can relax, but it takes more time doing the acupuncture versus chiropractic. You can have a subluxation corrected and instantly the dog's eyes change, their posture, the breathing gets slower, wider, their pupils, the adrenal gland signal goes down, so the pupils aren't as big, and it can happen in just a few minutes, and then I'm their new best friend.
Yeah.
Oh yeah, I like you.
What's the biggest? So when you're seeing a dog, can you, like my chiropractor, my human chiropractor? He's amazing. I can go in and he just looks at me and he goes, "Oh, your left leg's shorter than your right leg, and is your lower back hurting, especially here?" I'm like, "Yeah." And I'm just standing. I haven't even taken my coat off yet. And I'm like, "Yeah." And he's like, "All right, lay down." It's amazing, amazing. I go to him. We do TENS unit. We do heat. A little bit of massage. He's incredible. And I go to him more for just proactive stuff. He just tells me what's tight. And anyway, can you look at a dog and see what they need?
Yes. First off, I can do it because I've had the training, but also because I started in that, like I did track in high school. I enjoyed running, and then in college, and then did weightlifting, body conditioning.
Cool.
So I already had the training and the awareness of how everything can affect the positioning of body parts. And then you just, riding horses and all that, but you get that eye, that thing in where you just look at them and you can just see it.
Yeah.
You just know. You can see where it's high, where it's low, where the muscles are tense, where it's not even. It's, I can speak for your chiropractor. The most difficult thing is to like be in an airport or a shopping mall or someplace where there's lots of people and not
see it.
As soon as you're walking behind somebody, it's like, they got this, they got that, they got.
Yeah.
It's just like your eyes and brain are always doing that. And it's the same way with the dogs. Yeah, I can look at them and can pretty well tell before I even put my hands on them where some significant issues are. And then we go to work.
What's the biggest thing that you see in most dogs? Like if people are listening right now, like what could you say like, hey, this is what you can look for
So
in
I'd
your
say
dogs?
3 zones, really big. One is the pelvis. The pelvis can shift. One side can be higher than the other. It can also drop. So a pelvic shift, that's one. The middle of the back, where you see where the ribs and the lumbar come together, that area is another one that tends to have a lot of issues. And then the atlas, which is the first bone off of the skull.
So like
is
right on the
another area.
spine, like right behind the ears.
I got one here.
Show me,
How
yeah.
about that?
Awesome.
Okay. So this has never been a real body. This was designed.
It's not cadaver.
No, but the dogs, like when they see it, they got to come over and sniff it. They think,
Yeah.
no, there was never any meat on that, so don't be thinking it's good. So this would actually be the skull. And then this would be the atlas, which is the first cervical vertebra. And it wants to sit even. You can see it has these, what are called the wings on either side. And it wants to be even with the skull. So there's a lot of motion between the first and the second. And what'll happen is, and this can happen with being pulled with a collar, and it can even happen at birth, but the atlas can shift. It can get high on one side. It can shift that way. It can shift forward on one side. This is tight here. The body has a lot more motion than what my spine is giving me today. There we go. So you could see that can move back, forward. It can go rotate different directions. This particular vertebra, C1, when that is sitting in the wrong position, can cause major headaches for a person. And I wouldn't have any reason to not believe it would cause the same thing in a dog. The second cervical vertebra, this one can also become distorted. It can get too high where it's sitting up this way from being, again, yanked potentially, even playing with other dogs. There's a lot of ways these can happen. The C2, though, affects the heart rate. And so this can impinge on the heart by that one being subluxated.
Whoa.
So what we're looking at is that, if I go back to your 3 zones, so that was the one zone. The other zone would be the middle of the back. So these really tall vertebrae, this is where the ribs would be coming off of. And then the lumbar is this. And then the pelvis is here. So this area, which is an area of transition, and we go from a lot of support under the vertebra to less support. This is another area. So the dogs that are that stand with their back elevated like that, and they should have a top, like say if you had a beagle, which is a very straight line back spine, if they're high there, you'll see them like that, then generally these vertebrae are sitting up too high. And then the pelvis, so I mentioned about it being able to rotate, so one side can get higher than the other. And this can happen because of hip problems, rear leg problems. Low back pain is going to cause them to change their posture in the pelvis. So when you look at the spine, I'm going to turn it sideways.
And what's that? Before I answer that, I'll just tell people, if you're listening to this, you can watch this tutorial on Spotify or on YouTube as well. So if you're listening to just audio and you want to see what we're looking at, you can on Spotify or YouTube. What's all the green stuff here?
Yeah, that's a good question. Those are felts, and those are actually mimicking the discs.
Okay, like humans.
So,
you know something? And this is kind of not off topic, but off dog topic. My chiropractor told me the other day, because I was trying to stretch my lower back and I was bending straight down to touch my my toes, and he's like, "That's a way to do it," but he said it's actually not that great for you to do, because what you're doing when you bend down, because your little felt, what are they called again?
Discs?
Yeah,
Your
he goes,
discs.
they're filled with fluid.
Yes.
And he goes, when you bend all the way down, you're shooting that fluid. Like if you hold a water balloon and you squeeze one side, he told me, he's like, you're shooting that fluid to the other side. And he's like, it's people always bend straight down to touch their toes. And he goes, it's not awful. He goes, but if you do it a lot, you're constantly shifting your fluid and your disc to the back, and it's not a good balance. And then you're causing friction. I just thought that was like, that blew my, honest, I think about it almost every day now, because that's all I used to do is wake up and touch my toes. He's like, it's not awful. He said, but just be mindful. If you do it a lot, you're taking that fluid and you're shooting it to the back of the disc.
Yes.
Interesting.
And what happens with the aging, so the inside, I always kind of compared it to like a soft marshmallow.
Okay.
And when you're young, just like a soft marshmallow, you can squeeze it and it comes back. As you get older, the outside of that disc becomes harder. It doesn't have that, like a dried marshmallow.
Yeah, it doesn't have the...
And so, yeah, it doesn't have the buoyancy, the give. And then when you squeeze it, it doesn't go back. And so that's what happens with age, is that these discs that sit between the vertebra, the bones, the discs that are supposed to be a cushion, now are less of a cushion because they're not as springy. And when you squeeze the one side, like you said, it'll distorts the shape and it doesn't go back.
Right.
So then, if you can see the silver part, that is the rod in here, but that's basically your spinal cord. The spinal cord's in the middle. There's a hole in each of the vertebrae, and the spinal cord moves through that. And then the discs are the cushions to keep some distance between each of the vertebrae, the bones. So now these little spaces between every single vertebra, this is where the nerves come out that go to every area of the body. The nerves come out through these, what are called intervertebral foramen. A foraмен's a window. So through these little windows between the bone joints is where the nerves come off of the spinal cord. And they actually, like what comes out of this space, lumbar, so if that's L2, actually the nerves come loose from the spine a couple vertebrae up. So say T12 or 13, and it comes down and then it comes out the hole and then goes to the body parts. So there is not any part of your body, not any organ, nothing internally that is not affected by the nerves that are coming out through the holes of the spine.
It's all connected.
So it's impossible to think that an individual's alignment of their vertebra, of their spine, is not significant to internal function.
Right.
It's impossible. So when we're talking chiropractically, what we talk about are motor units. So that's 2 to 3 vertebra with the muscles and then the tendons that connect and all of the nerves and the vascular supply, everything that's associated with that motor unit. Because if you have one vertebra that's not moving, so say we have one that's sitting high and it's stationary and it's not moving like it should, the ones on either side are overworking.
Right.
To make up for, just like on an assembly line.
Yeah.
If you're not doing your job, the guy before you and behind you's, this one's going to back up, and then this one's got to work too fast and do some of the job for it. So we can end up with a hyper too much mobility in an area. And oftentimes, that's the one that'll actually have the muscle tension. So you touch the dog there and they kind of quiver or they move away. It's a hard spot.
Like a horse does too?
Yes, horses do that too.
Yeah.
So you'll get the tight spot at the area where it's overworking.
Right.
But that may or may not be the one that's actually what we call subluxated. So a luxation is a movement away from a normal position. So if it's totally luxated, like you fell and you luxated your shoulder, it is like out of socket.
Yeah.
But a subluxation is, sub would be less than, below that. So it's not that bad, but it's still not moving in all of its different ranges of motion. So up, left, right, at a diagonal. It can't do everything it should because of that. So we correct the nerves, the muscles in that area.
By adjustments, you mean?
Yeah. So we would do an adjustment to the in a correct line. This is why you want to have somebody who's certified by the American Veterinary Chiropractic Association, because they've not only gone to one of the institutions, the colleges teaching animal chiropractic, to either a veterinarian or a chiropractor. So you have to be one of those 2 degrees first, either be a chiropractor or a veterinarian, and then you can get certified in animal chiropractic. But you want somebody that has been trained.
How long is that training?
So most of the programs are going to be somewhere around 300 hours of training.
Good.
So, and then it can continue on. You can do advanced programs. There's always more than that. And then the AVCA, the certification, you have to then take, not only have you taken your board's exams from the colleges that you went to where you got your training, then this association, to certify you, you have to do more. You have written exams and you have to do live adjustments on animals to people that are trained, that are on the board, that then verify you're doing that correctly before you pass.
Good.
So there's a lot to it, right? So you don't want just some yahoo going in and trying to do something. We do what's called motion palpation. So when I first see the dog, after what we talked about, your eyes looking and go, okay, I got this, I see this, I see this. Then we do motion palpation. So I'll start and I'll motion the pelvis. Can it move every direction? And I'll just gently check each of the processes and see, does that move like it should? Is there a nice spring? Is it bouncing? And I'll go vertically.
Now, what do you do with dogs who are aggressive? Muzzle them and deal with
Sometimes it's,
like,
first off, there's several things. First off, I don't, in my practice, and that was the reason I sold my regular traditional practice and went to the rehab. It's a totally different environment. They don't, when they walk in, they don't hear other dogs screaming back there, run for your life, they're going to take your balls, you better get out of here now. It's your last hope, you know. Right. There's nobody, the smell is different. Even I kept my clinic super clean. I wasn't using odor repellent things, but still, it's a different environment.
Yeah.
And the rehab center had bigger rooms. I always made sure there were windows, even in my traditional clinic. There was a window in the exam room. So they don't go from being outdoors to being in a smaller space to going down a hall to being in a room with no windows. That dog's mind, they have no way out. I had windows that went to the floor. So the littlest dog could go stand on that windowsill and look out in my traditional practice.
That's great.
And the rehab was like big space rooms, because you're going to have them, like your facility.
Yeah.
They have to be able to move to watch gates. Now, where I was, I had plenty of land outside, but sometimes it was snowing, it was raining.
Yeah, sure.
You weren't going outside to do this. So we had space inside where we could work, and then just doing exercises so that showing the people how to do fit paws and all of that with the balls and the peanuts and the tears and so much fun stuff.
Touch pads and
Cool. Yeah, placements, all that. So for a mean dog, so when the dogs come in, they're already not as charged up as what they would be
as a vet
in another situation. And I don't wear white coats. Nobody wears white. You know, that's another tip off. Yes, big trigger. So it's a more relaxed. I even had a waterfall, and it's just a relaxed environment. So they're already not as suspicious.
Good.
I have sometimes, if a dog was very like that, I might even work on him outside, because there's more distractions. Yeah. So if the person was one that had control. And also, I mean, I've worked on Class 5 trained Shih Tzu dogs that all it would take is they come in, they're super friendly to me and they like me, but if that handler gave them the signal, all of a sudden I would be very evil. Yeah. And they'd be all over me. Totally fine. Now, some of those are still questionable, and they would wear one of the boxes.
Yeah.
Mm-hmm. But not all of them.
I was just curious, because I know the people listening, they're like, man, this sounds great, but my dog would hate this. So I just was curious.
No, once you start and they get the idea, and it's just like, I'm not thinking that they're going to bite me.
So you're confident.
But I'm conscious, like my other eye is always, I'm aware of their body. I can tell if they tense up. I can watch I can see if the ear changes. I can see the client. There's so many things that you're watching for, that you're aware of, that other people just talk over, they're oblivious about. So
for
all
you.
of that helps too. Yeah. So
That's great.
and there have been some that would be that way, and so I use alpha stem microcurrent therapy, which is it's a FDA cleared for pain, but it also for stress related conditions. And I would use that on the dog for like 20 minutes. I'd have if I knew it was that kind of a dog, I'd either have them use it in the lobby while they were waiting, which is a big space, and the bad dogs could get over somewhere where the other ones weren't, so they weren't too close to each other. Or I'd go ahead and put them in a room area, and we would just do that for 20 minutes. And then it helps them get endorphins going, gets them relaxed. It helps that.
Is it like a noise? Is it like a pitch, or what is
No,
it?
it's a waveform, a specific waveform.
So it's like I have 2 young boys, and so we researched the difference between white noise and pink noise and
Yeah.
how it matters. Okay, so it's kind of like that.
That kind of thing,
Okay,
right.
cool.
Yeah, so it helps them get into that alpha state where they're chill. So I would do that on some of them beforehand.
Cool.
But I can't think of any dog that ever came in that I had to say, we're not doing this.
Good.
There was always something. Now, maybe you didn't get it all done, but there was always something that you could start with.
Yeah.
And then the next visit would be better, because then they realize, okay, there's no thermometers. You're not sticking
shots.
something on my butt. There's no needles.
Yeah.
I go out of here feeling better than I came in. Okay, maybe this is all right.
Good.
And I always gave them really good treats, the dehydrated something.
Beef liver or something?
None of them cheap biscuits. You got to go high end on this,
Love it.
Yeah. So we motion palpate up and down, make sure it can move that way. Then I check, can each of these joints move left to right? And then I check the other way. Can each move right to left? I do that all the way up through the thorax,
And you're feeling each
thoracics.
individual.
one by one.
Wow.
Now in vet school, you're not trained that. You might do palpation, but it's like big areas.
yeah.
Yes. And you will miss the thing.
Yeah.
Because you're in big groups.
Yeah.
Versus chiropractically, you learn to see with your fingertips. It's so different. And it's gentle.
It's very specialized.
Yes. And so now I know what's not moving and where I need to make my adjustments. So then there's specific ways that we set up to make those adjustments. So I correct those, and I go back and check, are these all good? So all that's good. Check the pelvis, I corrected that. Check legs, I check the hip. The hip can also be, so this would be the hip socket here, and then the hip bone would go in there. So the depending on the continuity, there's actually a little teeny ligament that connects the head of the femur inside that joint. And so that little ligament, if it's looser, then that may allow that the head of the femur to not sit as tight. It can actually maybe sit a little forward, a little rear, depending on how the muscles are. So those can also be corrected. The tibia can be off, and the fibula and the hock. So all of those joints get checked. And then,
Why are the can I ask you this before I forget? What's the deal with the hackles? So are the hackles of, and you may not know this, but is the hackles of the dog related to bone at all? Or when the hackles go up in a dog, is it more nervous system?
it's nervous system.
Okay.
Yes. So you can even have, so they trigger that based on their autonomic nervous system. So they see something, they get excited. They want to make their posture be bigger. They want to look bigger.
Peacock,
They want to put that, and the adrenal glands are going, yeah, go for it. I'll give you it all you need. And so then, yes, their hackles come up. But also, you can have some that actually have that happening in a body, and horses will do this too, where there's an area where the nerve input there is like in an overstim, but maybe mentally they're not. They're not in that, I'm big and tough and big bad right now. But you can have a zone where the fur may stand up where it didn't before. And that can be because of an endocrine nervous system malfunction that's causing that. So it's all nerve related.
Yeah, so
Mind, nerve.
I always tell people that the hackles, and for those of you who don't know, it's like basically
Piloerectors.
Yeah, it's your dog's head, and then right below their neck, kind of down, not on their back, but in between that area, your dog may put their hackles up. And some dogs, some dogs you might not be able to see it, but a lot of dogs you can. And I always tell people that it typically happens when the dog's just unsure. where they're like, they almost get into this, like, I'm either stimulated and I'm excited, or they're kind of like, what are you? And they're meeting another dog. They kind of have this, and it makes sense. Like, they have this adrenaline type response where they're like, I'm really excited to play, or I might have to fight. They're almost a fight or flight response
Yes.
type thing.
Right.
And so I always tell people, because some people say, well, the hackles are up, so he doesn't like. I said, that doesn't really, if your dog's hackles go up, in my experience, it doesn't always mean that they don't like something.
No.
It just means that they're stimulated at that moment.
It's a warning.
Yeah.
Kind of a thing. They're like, they're just preparing themselves against what the other one might think, because they don't know who the other one is or what that
Right.
thing is. I mean, they could even do it sometime, a statue.
Yeah.
It's not even alive.
Right.
A statue is something, they come up to it and they're like,
My dog does it for sounds. He hears something and he just hackles. Kind of looks like a ridgeback at that point.
yes.
So,
Right.
can I ask you this before I forget as well? A big injury or a big, I can't remember the name. You'll know it. It happens a lot. It happened to my neighbor's German Shepherd. It's like that condition.
FCE, fibrocartilaginous embolism.
No, it's like
Degenerative myelopathy.
maybe. Is there another name for it where it's
DM.
No, it's like the dog's spine. So it's like a German Shepherd, and then his nerves in his spine started to go out, which makes his back legs fall out. The dog, everything else is fine. Like even orthopedically, the dog's fine, but then they get this condition. Not
Yeah.
Richter's. I don't know why that's coming.
DM, degenerative neuropathy, degenerative myelopathy.
And that's common?
With shepherds, yeah, they even have like hereditary. You can do testing early on to see if they're a carrier for that gene, or
With, like
if
the
they're-
puppies
Yes,
and the mom, obviously you would.
right.
If you're
yeah.
a
if you're a really good breeder,
Yeah.
both sides would be tested
Right.
first, and you certainly would want them to both be negative. But otherwise, even if you had two that were carriers, if you had one that's negative and one's a carrier, you could get by probably mostly okay. But if you had two that were carriers, when you do the chromosomal tic-tac-toe board, you're going to have some that are totally fine, others that are carriers, but you're going to have some that end up with it because you've got two carriers. So you have a dominant recessive, and you're going to end up with two recessives, and they're going to have the disease. They will get it. And of course, they don't show it as a puppy, but somewhere after 2 or 3, depending on how severe it is, it'll start.
but you can test the puppies.
You can test
And then
it for that.
what could you do if they carry that and it's going to come on? Like, what can anybody do?
So if they carry it, well, number one, what could you do? You make sure you're not going to breed that dog.
Right. But if a puppy
2.
has it, like, and
Yes.
somebody bought it or whatever,
So the
There's
best
there's
you're going
not-
to do is going to be repeated chiropractic, doing acupuncture in their life. You're going to do everything to support the nervous system.
okay.
So there are even nutritional wise, this will get us into our next topic, which we can pick up in a little bit, but there are ways to determine like heavy metal toxicities. There's things that you would want, anything that would further affect the nervous system. Now the catch here is going to come in when you want to treat for fleas and ticks. Most of those topical and oral pesticides for the fleas and ticks are nerve muscle degenerative to the parasite. But when it's applied to a body for years and years, it's going to do a similar thing to those cells of that body.
Yeah.
And so when you have one that is now carrier or could or tested and does have it, even though you don't see signs now, the more things you do that impair the nervous
Right.
system to function, the greater likelihood you have of it showing up earlier
Right,
in
right.
their life, versus not until they're 8 or 10, but it shows up when they're 3 or 4.
Right. No, that makes sense. You know, there's certain breeds out there that have, like, are there breeds out there that have chronic and consistent issues that should, like, if somebody has this breed, they need to go to a chiropractor? Like, are there certain breeds out there that have more susceptibility to different things?
I would say any of the chondrodysplastic dogs. So that's going to be
What's that mean?
like, those are the dogs that are more like the midget type dogs, the ones that are shorter legged,
Corgis?
longer bodies. Yes, like
Right.
corgis, like dachshunds, like Shih Tzus fall into that a little bit.
Pekingese?
Pekingese, yes, they would be that too. Any of those, and also those chondrodysplastic tend to have funny positioning of their front legs. The elbows are out, the radius is bowed.
Bow-legged, yeah.
Yes, those kind, yes. Now, when we're talking about posture conformation, see, that is their conformation, but it is distorted conformation.
Meaning
that will
that's the way they're supposed to be.
That's the way they genetically are.
Okay.
But in their bloodline or their breeding or the mix of the two breeds or whatever, but chondrodysplastic would have come about not because of ones that had the best posture to begin with. They don't have a nice square box with the leg length and the length of the spine and all that. So yeah, so that's their conformation is that. But then that is going to create postural deviations because of that poor conformation.
Right.
Yeah. So all of those definitely would need it. And then really any dog that is doing a lot of activity. So agility dogs, Schutzhund dogs, flyball dogs, dock diving dogs.
Fast cat. You ever see
Yes.
that? The fast cat? It's really cool. Some of my staff do it. It's like where you've probably seen it. It's where they put the white little prey and they put it on the line and
Yes.
the dogs have to chase it and they rate their speed.
Yes.
Yeah.
Oh, yeah. So they'll do that like for whippets, all of those.
Yeah, exactly.
Whippets, yeah. Yeah. So, yeah, I've adjusted lots and lots of whippets, greyhounds, all of those. And any that are getting body blasted, even just having big dogs that play together a lot.
right.
You got a chance that something's going to happen. And it's better, I always say, it's better to handle a little nothing than wait till it's a big something.
That's right.
So keep up with it earlier. And there's some dogs that maybe once you get them set, they only get adjusted every 3 or 4 months, 2 or 3 times a year or something like that. But there's other ones that are going to be more regular because of their lifestyle, just
Right.
like with people.
That's
the
right.
rougher you are in your body, the better likelihood that you have something that might need help. And diet. The better you eat, the less sugars, the less carbs, the more real foods, the less preservatives and things like that, the better quality food, the better nutrients are there to support the structure.
Okay.
But I can say from all my research and what I've published is that there is no food out there. It doesn't matter the best raw diet. There is no food that's going to compensate for all that the metabolic processes need anymore in a dog. You can't, there's no AAFCO regulations, so the feed control officials regulate animal feeds, and they say you need so much of XYZ. Everything is calculated out, and that's what the dog needs.
Yeah.
Well, a lot of that was actually done on dogs in laboratory situations. So they weren't exposed to fleas and ticks. They weren't out on the grounds where there's pesticides and other toxins coming in from the environment. None of that is part of that testing.
Okay.
So you get a lot of these that suck, like glyphosate pulls nutrients out of the body tissue. And anything that's a plant product, you got a pretty good likelihood it's going to have glyphosate in there. So that's Roundup. It's a weed killer, but it gets into the plants then, and then it gets into the food supply and then acts in the body to pull nutrients out of it as well.
So the nutrition and the food that you feed your dog affects what you're talking about here.
Exactly, it does. It affects the ability of
spine
the
and-
nerves to function. It affects the the quality of the bones. It affects the stability of the ligaments, the tendons, and the muscle tissue. It affects all of that. The protein availability, the sturdiness of all of it, and the resilience. So some can get hit and they bounce back. Other ones get hit and then they can't move because they don't have the good supporting structure to be able to counter what just happened. And certainly that gets gets worse as you get older.
Right.
Because all the suppleness and the fluidity becomes less. So it is a part of aging, but we don't want to just assume that, oh, they're old, so that's how it's going to be, so just live with it. No, you can get them adjusted. You can do acupuncture. There's so much. You can do exercises and rehab, and sometimes just even training the dog to sit square.
Yeah.
Because, a lot of dogs, they'll want to roll over to one hip. They do what I call the pig sit,
Yeah, yeah.
especially those chondrodysplastic dogs, because it's so easy. Their body's long, and they just always sit like a pig off to one side.
Yep.
Well, that doesn't help them then when they go to get up, because they're going to end up pulling more from the front, or they have to reposition themselves. They're not driving from the rear. So you have to teach them to sit square and to use those buttocks muscles and to create a strong rear end, because that's where the driving force comes from. They drive from the rear. So I've I've been to some dog training places where I've watched trainers, not to your caliber, obviously, that was teaching the dogs to sit, but they didn't have the dog sitting in a square position. They would tell the dog sit, the dog would sit, but it was sitting poorly.
Yeah.
Which is not a part of its ability then to do the next thing is already impinged upon because they're not even sitting square. If you don't sit square and have the hips, the stifle, the hock, and they're flat on the ground, and that's so pretty when you see one sit like that,
Yeah.
and their paws are pointed forward. You don't have one out and off.
Yeah.
Beautiful. It's like I praise people when they have a dog, and some of them, like they just do that on their own, and you look at that and go, that dog feels so good. His rear end is so strong to see that. And then, and the same thing in the front. You know, you want to have those front legs where they can then engage themselves. So training just to do a square sit sometimes is the first step, even for an adult dog. They've never sat square, and now they're wanting to make sure, okay, they're getting older. What can I do to help them in their age? Well, let's get them to sit square, and that can take a while when they've never done it, and also if they've already got some joint idiosyncrasies,
Right.
partially because of not sitting square, but whatever else was going on genetically or functionally that didn't get corrected when it was a little nothing. And now we have this bigger scenario, but there's still so much you can do. Changing all of that, and then the dog's ability to go upstairs. And you think about an older person that's not going to be able to pick this dog up because it's not a 7-pound dog. You know, they're older and the dog's 40 pounds or 60 pounds. To have that dog be able to do these steps and do these things easily helps save the dog's life.
Yeah.
Because sometimes the limiting factor in the dog's longevity is that they can't get up easily and the person has stairs and the person can no longer, because of their condition, help the dog. They're left with no recourse but to euthanize the dog.
Jeez.
Which is sad that if the dog had had this help earlier and had built that rear end to where it was strong and stable, they wouldn't be as weak as they are when you get to that point of age.
Yeah, and a lot of my colleagues and people who do sport work, so like French ring or what they call IGP now instead of Schutzen, or Mondio ring, bite sport stuff, they get judged on how their dog's positions are. And so they teach them to sit and down in boxes for that reason.
Yes.
So they sit properly and they down, like the same thing when you're talking about how it looks really good when you get a nice down and the dog is just
that Sphinx. Oh, isn't that beautiful?
Yeah, exactly.
Oh my gosh, almost makes me want to drool.
Yeah.
But I say, oh my gosh, they're so beautiful.
Yeah.
And people some of them don't even realize how good their dog is. You know, like I praise them, like I show them exactly. So they can now see it. They don't know to see that. But oh my gosh, that is so beautiful.
Yeah, it is. It's cool. It looks fancy, but it's really just how they're supposed to be. And
Exactly.
one thing that I always suggest to my clients who have larger dogs is we do an exercise, which I'd like your opinion on, because it's just something I've always done. We call it rear end awareness. And so we're building the rear end muscles, because it seems that a lot of dogs, if you haven't taught them how to kind of compartmentalize their rear end,
Right.
That's why, so what we do is we do a touch pad with food lure. So people who are listening, let's say you have a dog and you teach them, and if anybody has seen me do this with Lakota or even Burley, my Mastiff, at an early age, we teach the dog how to put their 2 front paws on a trough bowl, touch pad, right? We flip a trough bowl, like a rubber one that you would give livestock, flip it, the dog touches. And then what we do is if you do that with the dog, and they want the food, and you start moving in a circle, the dog who doesn't have rear end awareness will stretch their neck all the way around, and they won't move their back end. And that's why I tell people just simply, I'm like, your dog can't access their rear end. And I don't know if it's neurological or if it's muscle or both, but it's funny to see. It's actually really rewarding to see. Once you start getting a dog who knows rear end awareness, you just move and their back end goes, and they just start moving their rear end. But almost every dog I've ever worked with on rear end awareness cannot do that unless you teach them how to access that rear end. So assuming that that is good for bigger dogs who are going to need that strength and need that muscle and need that dexterity to be able to singularly move that big butt around, because in the future they're going to need it. But that's what I tell all my clients with big dogs. The reason why we do it is for what we call focused healing. So let's say you put a dog in a heel, and Schutzhund is a perfect example. All those dogs will focus heel. So the neck goes all the way up, and they're looking and they're prancing. And then when the owner turns, their rear end is sliding with the owner. They're not like doing this one step at a time. They're just sliding. And it's cool. I have a couple dogs that will do it. You move this way, and they just move with you. But that's how you start it. So would that be a good way for people out there who have a medium or even a small dog to start on, just to start moving their rear end?
I think it's really good because it's small increments, and it is helping them to. I mean, they're going to figure out how to move their body around. So I think that's totally fine. I've watched some of your podcasts with you doing that, and I think part of the reason they haven't paid any attention to the rear end is because the human is all about the front.
Yeah.
You know, they're at the front, they're talking to them, they're giving them their treats, they only do front end work, and they don't really focus on the rear. The other thing that I do that is one of the first when I'm helping them to get that muscle strength is to learn how to reverse walk.
Right.
And that again is making them think of the rear end. And it's strengthening the opposite muscles from the ones that they've only been using. But just like you said, putting them in a box or square, I'll have people do it along a wall in between the sofa and ottoman. And the other thing that's really, so that helps keep them in that neutral position. Because otherwise, like you said, they want to just bring their front end around to do whatever it is.
Yeah.
They don't have that, okay, I don't have to see necessarily to do this. I can do this motion without looking.
Right.
So I can go in reverse without seeing. The other thing that's really, really important is when you do that reverse is that the nose is not up. Because biomechanically, when the nose elevates, the rear end has to drop. It's just the biomechanics of it. The nose goes up, the rear end goes down. We want a top line that's level. So they have to bait the dog. And this is one of the things with the Schutzhund training in that a lot of them, and even with a lot of the dog dancing, the different things, the head's always up, which means the rear end's always lower, which is always, their rear legs are rarely in an extension neutral position. They're always crouched because their head's so far up, and the weight is always being loaded to the rear.
Yep.
So when you do this walking in reverse, you have to keep the top line level, which means giving them their treat with their nose down this way towards their chest. You bait them to here, and then they learn to walk in reverse, keeping that top line level without elevated and low in the rear and going back in that kind of a crouched position. So that has to be like along a wall between something generally to start them, because they don't get that. They want to just, and because people normally tell them to sit and give them their treat up this. So it's a whole new training thing. So doing that reverse walk and then doing something like that where they're going in the circle and starting to cross. Now, if a dog resists doing that side pass walk, if their pelvis is subluxated, it's going to be difficult for them to do that. So they may have to get them adjusted for the dog to freely, willingly do that, both directions.
Right.
And you may have them where they do one side good, but the other side's not so good. Now, you can always be left-handed, right-handed, but you're going to create a stronger side and a weaker side by being one-sided. So you can be ambidextrous, and that would be optimal. So on a dog that can't do one side equally, my first thing would be, let's get him adjusted and make sure that all the joints are moving so that he can flow that direction, and it isn't a block towards that motion.
And if somebody just to remind, I know you said it, but if somebody wanted to go find a professional chiropractor for their animal, what are the regulations and that you recommend if they went into Google right now to say?
So go to the American Veterinary Chiropractic Association's website. It's avcadoctors.com or American Veterinary Chiropractic, so avca.org. One of those two ways you can, but avcadoctors.com gets you to a website, and then it lists out everybody in the whole world.
Okay, good.
And you just go into your zone and then find doctors in your area, and they'll either be veterinarians or chiropractors that have been certified.
Good. Okay. Yeah, because a lot of people do listen to this outside of the country, so that's why I was hoping that it would be an international thing.
Yes, there's even a certification program in Europe. There's a lot of programs now going on in Europe with really good educators and doctors too.
Good. Yeah, but you would recommend, it sounds like every dog over the age of what should be adjusted or would benefit from being adjusted?
Over the age of being born.
Okay.
You can't
Perfect.
Start out young. Yeah, don't let it become. Why wait?
Yeah. Just like people.
Start out little. Yeah, and if they have, there's some kind of accident, something happens, get them back in and get them checked until you see what they're, I'm talking young, until you see. I had a 3-month-old one time. Amazing how subluxated that little dog was. And that dog was aggressive at 3 months.
Maybe because of that?
We adjusted it, its whole personality changed.
Wow.
It
How
was
much do you see of that?
uncomfortable and in pain. Oh, I get a lot to different degrees that are evasive and angry because they hurt so much.
Gosh. And the owners probably have no idea. They call me. Hey, my dog's aggressive. My dog bit my son or whatever.
Yeah.
And they're like, well, they're in pain. Could be.
Yes, exactly. You want to rule that out before assuming it's a bad dog. As in, my dog's gone bad. A good dog doesn't go bad. If there's something wrong there.
Yeah.
And so first off, rule out that kind of pain. Don't just go say, oh, he's in pain. I made an appointment with the vet. They gave me some muscle relaxers. They gave me a pain pill. That didn't fix the problem. It took the reaction, it took the pain signal thing, it took the pain part away, that inflammation, but it didn't correct the reason that there was pain.
Yeah.
The adjustment is going to do that, getting them adjusted and revitalizing that nervous system, all the nerve messages, the signaling, the nerves, the supply to all the tissue and organs, and the relief on the areas where there's been impingement and lack of motion, and restoring. You can just change posture by correcting the subluxations. And then they become more comfortable, and then they can do the exercises.
Yeah.
A dog that's kyphotic, that one that's high in the middle of the back,
So you literally will see like an arch.
you can see that. You can see him elevated.
My
there.
older dog had that. She was senior and she had that arch.
Yeah. So that'll shift their pelvis in the rear end, and that alone will cause them to not be able to do things with their legs. And you correct that, and now the spines, even the pelvis changes its position. Now they can sit, climb, do things that they couldn't mechanically do.
Without pain, right?
That's right.
Yeah.
Without the pain.
Yeah, anytime. So anybody that's listening, I always tell dog owners that if you have a dog that is doing something that is totally out of character, totally all of a sudden we bit somebody or something, I always, as a behavioral expert, I always say get them medically checked out first. I did a consult last week with a guy with a Rottweiler, and his dog had went after a girl that his neighbor or something, and he was like really taken back by it, and he ended up going to the vet for something, and turns out he had a decayed tooth, and that was it. I mean, toothaches are awful.
Horrendous. And that's an area where people don't tend to look too much because the lips cover it up, and especially if that's in the premolars or molars in the back, it's hard to find.
Yeah, it was awful.
Yeah.
Yeah. So how much? I want to go back to nutrition because we touched on it, and you basically said what dogs can't really get what they need regardless of what diet they're on. What have you found? Because you said that everything's and I agree with that. I think food is medicine. What have you found to support good spine and good nervous systems and in your research? Like, have you found anything that is good, like either added vitamins or fish oils or a good nutritionist diet? Like, have you found anything in particular?
Oh gosh, yes, and I can go even deeper than that.
Let's get into nutrition because I want to hear. It's one thing, obviously, like we put into our dogs at least once a day, sometimes twice a day. Like it's huge. So I want to talk to you about that. What have you found and what do you recommend?
Okay. This is one area that I've delved into very deeply. And now that you're getting to know me, you can see that I don't just take something on the surface. I keep going. There's got to be more. There's another reason why. I'm still not at the end of this chain. I'm always looking for what's the real why. It can appear one way, but why is that? So you've got indigestion. Why? Because I ate this. Okay, but why does that affect you?
Right.
So the same way with the animals, it's like, okay, I got the chiropractic training. I'm helping a whole lot better. I've got my rehab work that I've done. I've done training in pain management, and I've lectured at the American Academy of Pain Management. I've done a lot in that area. I've learned the ins and outs of microcurrent therapy, like leading authority in veterinary microcurrent therapy. I actually invented the first spinal laser, low-level laser pads that were ever made, manufactured, and that was in 1998, 99. Yeah, the first ones that were ever made for the bodies, and the first 6 that came off of the press, this was in New Mexico at that time, went to a human hospital, a human neuro hospital in the Netherlands.
Wow.
Yeah, back then they were that advanced in looking at laser. Of course, it wasn't cool in the United States yet, and I've gotten used to getting shot at with arrows. You're always dodging, but to be on the edge, I think, is to be a leader. If you stay in the middle of the pack, you're not really the thinker, you're not the leader, you're not changing the status quo of existence for the good. So I'm always on that edge. So I got the pain better, rehab, I got exercise, I got all these things on, but I'm still seeing things that are not right. And that took me into nutrition. What is the other thing? What do they look the most forward to besides you coming home, going out for a walk? It's the food. So that's the one thing that we really have control over. So I delved into and actually started in about 1998 after I got certified, looking more about exact vitamins, minerals. And as veterinarians, there's very little training that we get prior to or in vet school unless you really focus on nutrition. There's very little that's demanded or required, very few courses on nutrition. And if we look at animal husbandry, century ago and before that, everything was about what's in the soil, what's in their food, what is vitamin that's too much, a mineral that's not enough. That was husbandry. That's how you corrected problems and then gave them a correction for whatever that was. And then, of course, once drugs came along, it became easy to change something with the drug, but it didn't fix the original problem, the original why. So getting back to correcting the why is this happening. So first off is looking at foods, and it's certainly getting them out of a processed food, because once the food in the bag, for the most part, are extruded processing, and that extrusion process ramps up the starch super high in the body, makes the carbs and the starch level be out the roof, and that is what creates all the diabetes that we see in dogs, and 100% in cats, because you shouldn't have a diabetic cat. They're a carnivore. A dog is an omnivorous carnivore, and in the real world, they only eat like 15% carbohydrates. If you can keep their diet under 25% carbohydrates, I'm fine with that. But all of those kibbles in the bag, maybe if it's a baked kibble, you might be in the 25 or 30% range. But I've done the math, and the math, you have to do the math, because on the bag it tells you protein, it says fiber, it says fat, it says moisture. It doesn't tell you carbohydrates. But those extruded kibbles, which is the majority of all of them out there, the carbohydrate load will be between 47 to 63%. That's super high when you think about they only in the real world eat 15%.
Yeah, I was just talking to somebody, and they said nowadays it could be up to 70%.
Yeah, I haven't done the math on any that was that high, but you can. So if you have, probably some of those veterinary formulas that's trying to stop the allergies, that's using hydrolyzed and has all the carbs, those could probably be that high. So the more rice, so like rice, the oats, the barley, more rice. You'll see recipes that have brown rice, white rice, barley, oats.
Yeah.
So you can have a lot of starches in the food. So that's a super big problem, because the dogs are not getting near enough protein, and it's not real protein anyway. So just be like you eating total cereal that says it's got all these nutrients and that's all you need. If you ate that every meal of your entire life, how healthy would you be?
Yeah, and I've also was reading recently, I was talking to the authors of The Dog's Table, which is that cookbook I was telling you about. And one of the things that they said is now what what AAFCO is allowing for kibble companies to be able to do. Kibble companies are going to come after me hard, because every time we get into this conversation, we genuinely get into this conversation. Sometimes I have people on to talk about it, but most times we get into this conversation because it's such a big part.
Because it's the truth.
It's the truth, yes. So one of the things that they were saying is now that when they're weighing their protein, like for chicken protein, they weigh it what they call wet They weigh it wet. So it's actually, and then they turn it into powder.
Way more.
Exactly.
than once
So
it's
they're
in
saying that, let's say this bag has, for an example, 20 grams of protein, but they're weighing it wet, where it's not, it ends up being like 5 or something lower than that, because it's not actually what they're getting, which is, I was like, that is a dirty move.
Yeah.
Especially for people who care and who are looking. They flip it over. A lot of people are just buying a bag of food to keep their dog alive, to be honest. And that's why these conversations matter. But anyway, keep going.
Okay. So yeah, so that's the first place, is correcting the food. But then I realized that none of the foods out there have what we need for the dog. So I started doing more and more research, and I got into the area of what in the humans was hair tissue mineral analysis.
Hair tissue?
Use the fur, yes.
Okay.
So hair is a tissue sample of the body, just like if you took a liver sample as tissue, or spleen, or lung, or anywhere else. So the hair follicles, they are bathed by what's called the interstitial fluid. And the interstitial fluid, this carries all of the nutrients. It also carries toxins. It also carries the drugs. Everything is carried in the interstitial fluid to the cells. So this is beyond the blood. So as the follicle is forming, it's bathed by this interstitial fluid. And then once the hair follicle or the fur comes out of the skin, then it has that cuticle on it. It hardens.
Right.
And that traps all of that information in there. That's why it can take samples off of cadavers and then send it to CDC and test for a certain poison, because it will be in there, because it was in the fluid that went to the cells that poisoned the person. But the same way, we can test it for minerals and toxic metals, and that's what the testing system has done. So this began in the 60s by Dr. Paul Eck out of Arizona, and he is kind of the father of hair tissue mineral analysis. And he also worked with other researchers at the time that were looking at, so Hans Selye is the person who coined the word stress and associated it with the autonomic nervous system, with the adrenal glands, with that fight or flight. He researched and laid all that out from a biochemical perspective, and how the body and the mind react to all of that, and how nutrients then, so Dr. Eck then connected up the nutrients that are deficient or in excess that could alter that and create more stress. And he worked with other researchers at that same point in time, looking at the oxidation rate. That's how quickly do you change the food that you consume and turn it to energy. Because that's basically what the food's about. It's our energy source to keep the motor running. So how quickly does an individual do that? Are they a fast oxidizer, a fast metabolizer, or slow? So you can't just look at them because they're overweight and go, oh, they're slow metabolizer. No, you have to have a fur sample and send it to the laboratory to really determine that. And the same thing with the hair in the people. So Dr. Eck did a lot of that research with the humans, and then he had a researcher with him that did a lot in the horse field, and now it's being... From there, it got into wildlife, looking at wildlife and other areas of the world, like taking different species and finding out what's happening that's killed these guys off. What are they exposed to in their environment, and getting fur samples from them and sending it in. So earlier, like I would say so he started his first lab in 1975. He opened it up in Phoenix, Arizona. So this is the original laboratory that the samples would go to for testing for humans, for improving body conditions, and then also for animals as well. Now, still, if your CDC is still in Georgia, so that's where other testing that would have something to do with interactions in the human world, they would go there for testing. But anyway, if you're looking to do it from a metabolic perspective and improving the quality of the life, and you're going to use specific supplements, then that's the laboratory that I use.
Cool.
Yes, and he opened his lab in 75, and earlier on the research was, okay, let's figure out how this all plays and which vitamins and minerals do what in this test. And if we add these, how does that change it? So that was the year of research. Then the next phase of research was, okay, now we got to prove to everybody else that you can do this. So then it became proving that hair tissue mineral analysis is a science technology. It's done by mass spectrometry. They mean these humongous, big, expensive pieces of equipment, and the hair is processed in a way that then they can extrapolate the information from it. So It's and as technology's gotten better and computerization has improved, all the quality of the testing has gotten better. So we got past the phase of the research, which was, okay, now we're proving that this all does work and we've got our systems down. Now it's into the area of this is being used for a lot of medical research. There's veterinary universities across the world and human areas that are doing. Korea had a study where they looked at dogs in urban areas versus in city populations and tested the mineral changes and toxic metals in those dogs in different populations, because that's an easy way to see what's going to be in the people.
Oh, yeah.
So they use the
Okay.
animals in areas to find out, is this a hazard for the humans
Makes sense.
in that area?
A lab rat
So-
type.
And then also more research into those minerals, and then like the toxic levels, like where are they coming from? Well, any place where there's a lot of industry and it flows into the air, so exhaust, or back in the 60s, 70s, 80s, and a lot of pollution. The factories didn't have regulations as much, and so a lot of it went into the waters. Well, a lot of these toxic metals, their half-life is hundreds of years. So from decades ago, we still have toxins that are in the soil, that are in the bottom of the ocean. So there's changes in frogs and fish, because some of them would get upside down and couldn't swim right because of the toxins in the water that they were exposed to. They just swim in circles and different things. So looking at all of that perspective, so there's research in those areas, and then even like tracking it down the way. So this use of hair or fur testing has really ballooned. So where before, just like with chiropractic, you had to fight the industry to say this is valid, we had to do that with the tissue mineral analysis. Same way with laser. That at first was like voodoo too, but now a lot of veterinary clinics have it and have rehab, and it's a big deal.
Sure.
And nobody thinks twice about it. So I started doing this. I've been doing this for 2 decades now. Started doing the testing and trained, had somebody that trained me. And then again, I just read and did more and more. That's how you get good at something, is by practicing it a lot and
right.
applying it and then doing it correctly. And I started finding patterns that were very common in dogs. So Arlene Tolan, who was my mentor, we actually in 2017 had an article published in the veterinary journal, peer-reviewed. There was 564 dogs, so a big number. And we looked at those dogs. We basically looked at calcium, magnesium, sodium, and potassium. Those are the electrolyte minerals. And we looked at those across those 564 dogs. So some of the dogs were normal. Some of them might have had liver problems or allergies or GI or whatever. There's a skew of, and this is published, and they can find it on my website if they want to read the whole article. But at any rate, what we found was 94% of the dog population, of those 564, large number, 94% of the dog population is extremely low in calcium and magnesium, and very high in sodium, and then also very low in potassium.
And were they all on the same diet?
No, they were on all different kinds of
Okay.
foods. Yeah. The key to this is that calcium and magnesium are the calming minerals. I'm going to walk you through these 4 minerals and what they tell us all. If a body does not have enough calcium and magnesium in the interstitial fluid, now the interstitial fluid is your cupboard, it's your refrigerator, it's your groceries. It's what is feeding all of your cells, for everything that's happening is carried in that interstitial fluid. So if they don't have enough calcium and magnesium in the interstitial fluid, that individual cannot be calm. Calcium calms the muscles, and magnesium calms the nerves. So we see anxious dogs because their calcium and magnesium is so low that they don't have the mechanism to chill. So my example would be like, say, a 9-year-old boy in a classroom, and the teacher says, "Randy, settle down, you're disrupting the class." Now, he understands what the teacher's saying. Be still, settle down. And he tries really hard. And that lasts for about maybe 12 minutes or something like that. And then all of a sudden, there he goes again. Because he does not have the ability to be able to be calm without an adequate supply of calcium and magnesium. So this is part of what can happen to a dog that has a very short attention span, that they can't focus, that they're ballistic about they can't stand the car ride, or they get over the top at the mailman, or not that there's not behavior associated with that, because there is. And you work to train them, and you can make headway, and some of them you're going to do better, but there's some that just can't quite hold it. Even though you're seeing that the dog understands it, they can't pull it off. Can be because their calcium and magnesium is so low, and there'll be some of them that they start out in the morning fine, and they're pretty good. But then the UPS guy comes, and he gets jacked up because he barked at the UPS guy, and now he's sucked up whatever little bit of calcium and magnesium he had to get kind of over that. But still, it's not enough, and he remains jacked up the entire day until finally the adrenal glands are in such exhaustion that he collapses and he sleeps overnight. Gets his body recharged. Now, there's no more calcium, magnesium other than what he got in his diet, but it's still not going to put him up. It's not going to fill the tank to the level it needs to be. And the next day, it's the same thing. Now, he might be better if he doesn't have that extra stimulatory incident, but they go for a walk, and then there's that other dog from across the street, and them two dogs got the thing, and so then he gets jacked up about that, and then the rest of the day he's panting, hyper, and all over the place, and can't chill until he's so tired he collapses.
Right.
That's a very typical scenario.
Yeah.
Then the sodium. The sodium is not salt. This is just sodium. A really high sodium. Sodium is our indicator on this graph. So we get these minerals graphed out. Sodium is about stress and our inflammation.
Okay.
So there are so many inflammatory conditions, inflammatory diseases out there, which creates this retention of the sodium. So why is the sodium retained? Why is this sodium high? The sodium is high because the adrenal glands are producing too much aldosterone. So that's one of the hormones. That's the inflammatory hormone that the adrenal glands make. Now, sometimes you want a little inflammation at an area to cause the body to help it heal, but you can't go overboard. When the adrenals are producing too much aldosterone constantly, the kidneys then have to work to handle that aldosterone. And what the kidneys do is spare the sodium. It starts pulling back in the sodium. So this really elevated sodium, and a sodium in a dog on a hair test should be a 29. Typically, on a first time doing a dog test, it'll be somewhere around 200, maybe 300.
Whoa.
Yeah, that's already like
Way
about
off.
10 times. Yeah, I've had it as high as 2,000,
Whoa.
900s.
And how do we know the base of 29?
Because of the early research that was done on other animals. So they've taken ones and done enough across the
median
decades, yes, that
Okay.
they've in different environmental situations and got numbers, and yes, that's where we've gotten our standards for the dogs and standards for the horses. And so dogs and cats are going to be similar. Horses and rabbits, being herbivores, would be similar, and then humans are different number ratios than what theirs
That's
are.
interesting. So it throws everything off.
Yeah. So the sodium is super high. So the kidneys now are constantly working. So you wonder, oh, why did my dog get early kidney disease? Okay, here's a why. So this is why I'm always looking for the why. Why did that dog's kidneys go bad? These people were feeding it a good diet. Why did it go bad at an early age? Oh, it's just the breed. No, not necessarily. Like there's a reason. So if we had inflammation super high, and these kidneys are always overworking even at a young age because of the adrenal glands. So now we're back into this autonomic nervous system, that signal. So the adrenals are your 911.
Yep.
So every time that 911 button goes off, the adrenals are signaled to do something. And so this is a part of all of that. So if there's not enough calcium and magnesium to help calm the body, the adrenals are going to keep running haywire. So the sodium rises. The other part, so the mental stress can also cause that sodium to rise, because the same thing. You're worried, you're fearful, you're signaling those adrenal glands. Inflammation, an itis, is also about adrenal glands and what they're doing. Now, there should be the counter to that, cortisol from the adrenal glands, and that's our potassium. It tells us about how well are the adrenal glands producing cortisol. And so you hear a lot about cortisol with people and eating bad diets, and certainly the cortisol would be high in a dog that had Cushing's. But the cortisol, when the adrenals are so focused on this inflammation and this mental stress, the cortisol cannot keep up. So normally the potassium is also low. So we have a part of the adrenals that's weak, can't do its job to counter the other part that's overworking. Now we look at that inflammation, all the inflammatory diseases, any itis, dermatitis, colitis, gastritis, allergies, those are all inflammatory. That cruciate ligament that tears, they know there's always inflammation in that knee before the tear happens. And what minerals does a ligament need to keep itself strong? It needs calcium, magnesium. It also needs manganese, which this comes into this whole high sodium. The body, in an effort to try to counter this really high sodium, restricts the body from absorbing manganese. Because if there's more manganese, for whatever, then the sodium goes higher. Everything's connected.
Yeah, it's like the my naturopathic doctor told me about like methylation.
Yes.
And how our bodies, like he told me like the big gear system. He's like, basically, he's like, he goes, if you're, this is an example, but he's like, if you're deficient in this vitamin, you're going to have more anxiety because now this gear can't turn this gear to turn off anxiety and stress.
Yes.
So it's kind of like that, like everything is connected.
Yes, and there's turn on signals, and then there's other glands that give turn off signals. So the adrenals are turning on, and they're telling the pituitary to go, and there's a signal to the hypothalamus to tell the adrenals to stop.
And it doesn't.
Well, sometimes that doesn't happen. If you don't have all of the right minerals and nutrients in the right places and enough volume to handle. Now, we go back 3 decades ago, there could have been enough to handle all of that. But with humans' lifestyles changing, the dogs pick up on their people's personalities, just the cycle of everything, and then the lack of the good quality nutrition, not feeding as we did hundreds of years ago.
Right.
And then the other exposure to all the other toxins. They're just caught in this vacuum of not enough of what they need.
So most dogs are lacking what they need, right?
Yeah.
So
94% of your dogs are going to be anxious because the sodium is high and the calcium and magnesium are going to be low.
So people who are listening, 94% of people who have dogs, so 94% of dogs.
Yes.
Are lacking these things that help regulate their mind, their body.
That's right.
How can they? So this test, how can they do this test? How does this work?
So that's another part of my venture. My adventure has been to educate more doctors. So I've been working on this. We have more veterinarians, more naturopaths, more from all over the world. I have students that come to my Clinical Animal Nutrition Academy that are learning how to do this. There's also, they certainly can visit me and I can help them get started with this to do the test, and I can interpret it for them and let them know what they need to do. There are now other doctors out there doing that in other areas, so I could send them to somebody in their area, some of the doctors that have been working with me already. And then there's also a program called checkpup.com. And the people can just collect the first sample. They can do it from home and send it. And so there were 2 entrepreneurs that found me, this was a few years ago, and wanted to create this availability for people because they'd done it for themselves. And so what is in checkpup.com is the tests run through the Animal Research Labs, the lab I use, and all the information is all that I do put into a computer. So it's all synchronized with what their results are, and that creates a report that says, here's the nutrients that your dog needs to help correct what's likely going on in their body.
Wow. That's amazing.
Yeah.
So I just wrote that down so I can put in the show notes so people are listening. I'll put this in the show notes if you're listening, running, whatever. So people can go and, is that the test included, or is that how to read the test? Okay, so you can do the test.
Yes, so that they could do it from home by getting this kit, and then they send it to the lab, and then they get the results through the CheckPup program.
And then
and they can even transfer it to their doctor. Now, we're still working on, a lot of doctors have no idea how to interpret this. Like a situation would be if the doctor got the graph and saw that the sodium was really high and the manganese was really low and decided, oh, this is your lowest one, let's give them some manganese. Well, it could make the sodium worse.
I've never even heard of manganese.
Oh, yeah, manganese is needed. Manganese, calcium, boron, magnesium are really important for ligaments. So those deficiencies are also what creates that torn cruciate.
Okay. Yeah, that's a huge operation. A popular one, unfortunately. That's
and that didn't exist like when I was first out of school in the 80s. And even up through the mid 90s, like if I did 5 of them a year, I'd had a lot that I did. And that was before TPLOs came out.
Wow.
Did the extra capsular. But now it's like 5 a week. People don't even blink at it anymore.
Yeah, and I've been again accumulating information from different people and talking to. I did a surgeon with Dr. Kelly Might. He's a veterinary surgeon in the Austin, Texas area, and he was telling me he'll do multiple a day, and it kind of correlates with everything we've been talking about with nutrition. You know, talking to Dr. Ian Billinghurst, he was saying that the food now is packed so much with carbohydrates that it turns into sugar and then it inflames everything. And so dogs are getting more cruciate tears and more cancers and more diseases than ever before. Like you said, you used to do 5 back in the day and that was a lot. And now people are doing 5 a day. And I don't know if it could be genetics, it could be breeding, it could be environment, but a lot of it also points to the nutrition, that the amount of carbohydrates they eat then inflames everything, then starts to basically set up like, okay, it's about to go, and then it goes.
Right.
So what do you, when people have these low, whatever it is in their dog, the low sodium or whatever, what are you doing like a supplement after, or how does that work?
Right. So we would then correct those deficiencies or excesses based on specific nutrients that provide the solutions for those altered patterns that showed up in the graph. So that typical pattern of that really low calcium, magnesium, potassium, high sodium, low manganese, phosphorus, chromium, all these others we look at too, that particular pattern really requires, if you were individually dispensing things, that you would have to take probably about a half a dozen, 6 or 8 different items to correct it. And I started doing that. And my clients would purchase them all because this is what we had to have. And then after a while, I go, Ava, you got to do better than this. So I actually have a formula that I designed that's manufactured from a company in Illinois. It's organic product that provides everything for that graph so they can buy it all in one package. Other than some of them, we will add in taurine. Some of them we might do MSM or a fish oil. Those would be the other things that we might add for that inflamed pattern that's not in my product. But otherwise, it's made everything so much simpler.
Amazing.
So that's available now to help with what used to be going home with a big bag of things. Now it's down to one thing. And I've got other formulas for other patterns. Yeah, just to make it simpler for people. And again, doing a better job at what I'm trying to help.
It's tremendous. It's incredible. And I think it's just education. That's why I like this podcast. Like I honestly, genuinely had no idea you were into any of that. So that is incredible. And so they do the checkpup.com. They pay for the test. The test comes. I'm assuming it's just a couple pieces of hair.
Actually, you clip it. It needs a teaspoon worth. Okay. So yeah, a Chinese crested, a hairless dog, you may not be able to do it on them. But majority of dogs have enough fur. And I typically clip from an area like under their tummy or their chest, someplace where they don't have a bald spot. But if they don't have fur there, you can clip it from anywhere. And I've sometimes had to clip from under the tail, inside the ears, to get enough from a really short-haired dog, like a Chihuahua or somebody. I'm clipping a lot of spots, creatively, trying to not leave them big bald spots, and get enough fur to tip the scale.
And then you send it in, and then it goes out to the test, and then they send. So how do? Is it all in the same? Is it all encompassing? They send you the link to then buy the packaging of things that you need, the supplements.
So on the Check Pup currently, the program that we started with, and they still have, just gives you a list of different like vitamins, minerals, nutrients that you need. It doesn't give you a product.
Okay.
So there's that part of that program. It gets you started, but it doesn't say exactly what you need. So me and the students that I train, you're going to get the exact products that
it's all on CheckPup, though. It's like when people, because I'm going to do this.
So you just want to Google avafrick.com and send me an email and go, okay, Ava, I want to do my dog, and then say, okay, here's the form, here's the paperwork, here's what you're going to do. I would have you send it to the lab. Here's a form you fill out for me so I have more data, and then I'll get the report in about 3 weeks or so. It takes about 3-week turnaround.
Okay.
And then I'll put it all together for you.
But what about the thousands of people who listen to this? because I'm sure you don't want that many emails. So when they do the check pup and they say, hey, this is the things that your dog needs and the supplements, do they give you a link to say, hey, here's where you can buy these supplements?
No, that's the catch to it.
Okay.
They haven't merged into that part of actually like promoting a company because they don't have that group. They don't have the product themselves within that company, and so they hadn't merged into promoting for somebody else.
Okay.
Like one of the other companies I'll use, depending on the graph, is Platinum Performance, a big animal. They do a lot with veterinary and for horses and dogs. And so I'll use some of their products, and that may be one, depending on the graph, that I might recommend for somebody to go purchase.
Okay. But they will consult with you at some point, or somebody?
Yeah, they'll send you to me.
Okay. And then you can, because I would just worry about if people are like, wow, this sounds great. I can test, if I have an anxious dog, if I have an aggressive dog, or you
Yes.
just want to test to see what your dog is low in general.
Right.
I just want to make sure they have a good roadmap to get what they need.
Yes, and that's kind of a roadmap there. If they really want specifics, then at some point right now they'll still get connected up with me, or I can connect them to somebody else that's trained through me in the area. But the one thing I want to say is there are other companies out there doing testing that'll give you reports, but I have seen many of those come to me because of clients going, okay, I had this test, but it doesn't seem to be working, or I'm just not sure about the results. What should I do? And I'll look at the answers, and I can tell that the person that's interpreting that graph hasn't spent enough hours training, as you go back
Okay.
to the knowledge, to give them the right answer. Because I look at that graph, and I go, okay, like this thing that they said, okay, that's fine, but this other part is not correct. And so the people aren't getting the right answer. So unless they're using analytical research labs. And part of it is that some of the labs actually wash the fur when it comes in. Now, the lab I use does a cleansing process, but it's not washing it. So if you add water to it, which is different than while it's still on the body, it actually will wash out some of the minerals. So you don't even get an accurate test result.
Son of a
You got to
gun.
make sure that the lab doesn't wash the samples. And many of the labs do for whatever reason. They haven't studied the research that says don't do that.
So I'll put your website in the show notes then, and people can.
That's fine. And then I can, refer them to somebody that's close.
Okay.
to 'em. And I have samples
Amazing.
that come from all over the world.
Cool.
Yes.
Amazing. And then have you found that to any of those deficiencies linked to skin issues?
Oh,
or-
gosh, yes.
Because I have my Mastiff. Are you familiar with Borbals at all? South African Mastiff.
Oh, okay. I've seen
My
pictures.
dog?
Yes.
Yeah.
Oh, yeah, I've seen him. That's
Okay.
right, yeah.
So he's been suffering from what turns into dermatitis every 6 months.
Uh-huh.
And I'm working with Rodney Habib and a couple different like animal biome tests to do his gut. We're going to figure that out.
Okay.
I sounded Canadian there. I'm not out. But he's just like, it's even started again and I've switched proteins and I've switched food, and it doesn't seem to be a food thing. And so he gets these little, to me as a uneducated person on skin, it looks like ringworm.
So they call them rosettes.
He gets these little rings, and then they start off small, and then they just start to get big, and it'll start in his underbelly, and he's mostly bald under his underbelly, and then they start to come up, and then they get into his fur, and then all these little, he looks like he has Dalmatians, and his skin falls out.
Yep.
And then he gets really itchy, and his ears.
And so you said every 6 months.
It's not consistent. Like it's
okay.
just been, like it just started again. So it
Oh,
just,
in the winter, even
Yeah,
though
exactly.
it's this cold. And he's got it going on now.
just started again.
And you did nothing different at home.
No, I mean, we're pretty mindful individuals at home with products, right? So we don't use anything harsh because we have kids, and we don't. It's been really frustrating. We're trying to figure it out.
So see, he's what I would consider an exotic breed.
He is.
Yes. And one thing that I always tell people with exotic breeds is that you need to feed them what they ate from where they came. I know. And so in Africa, we get a lot of breeds that eat a lot of bugs, even that eat, like if you Egypt, they eat dates, they eat nuts. Their diet is very different than what they eat here. Even if you're feeding them a raw diet, it's still different. So for exotic breeds, it's really important. I have a section I call Feed for the Breed, where they came from.
Section in what?
Oh, on my website or in my education, my nutrition programs that I do.
Check that out.
So on my website, there's a nutrition page, and there'll
Okay.
be a section about Feed for the Breed.
Love it.
Yeah, and going to what they ate, where they came from. That will help you, number one. Number two is your microbiome treatment will not will not stabilize until you get these minerals corrected, because his body is supporting the friends and family, is in his gut, his friends and family there, is supported by the nutrients that he takes in, or that is available to those microbes. And so he will only have a certain percentage of those, because he doesn't have enough of the other numbers. He needs other things to stabilize that microbe. Whatever he has now on that test is all the ones that are really going to live there until you correct his nutrient balancing program, until you do the TMA. So I've seen this happen many, many, many times with clients come in that have been doing the microbiome, and they've been doing it with the doctor, and they go, yeah, I did it, and it looked like it was going to be good, but then it's not helping. It just really hasn't taken hold. Well, that's because you can put them good ones in there.
Yeah, like I'm doing an FMT right now.
They're not going to exist. They can't live there because it's not their environment. It'd be like
So it's not
taking an
sustainable?
aloe vera plant from the desert and then bringing it here.
Yeah.
For the summer it lives, but once it freezes, that plant dies. It's
Yeah.
not the environment for it. So the environment of the gut, you're putting these new ones in to help that environment, but they are not going to live very long
see.
until they have
I see.
what they need
I see what you're
to
saying.
live off of.
Yeah. Because that's what we're doing right now. We're doing the FMT, so the fecal transplant. But here's what I did is I started to piece these things. So my breeder called me, and he's a great breeder. I mean, he cares so much. He calls me anytime I post something about him, he's like, he gives me insight.
Yeah.
So he said, and I didn't know this. He goes, I was thinking that both his mom and his dad were born and raised in South Africa. And he's like, whatever he's eaten here, or even the environment, because it could be an environmental thing. He's like, it's different.
Yes.
And he's like, I was just thinking about it, because he came from Texas,
Yeah.
much more similar to South Africa, I would assume, I don't know, than upstate New York. So that's what he was saying. And then talking to Ian Billinghurst, he kind of jokingly said, well, to your point, he said, if you're going to do a fecal matter transplant, it's probably not going to be helpful unless you go to South Africa and get that fecal matter from his genetics to then transplant. But then what you're saying is if we do that transplant and we recalibrate his gut, it's not sustainable because he's internally lacking things to support it.
That's right, to support that.
Wow, this makes
that
sense.
friends and family that you're reintroducing to him. Now, here's the other thing, that just from skin, vitamin A and zinc. And I would say those are two, and I'm just off the wall from
Sure.
zinc is the most deficient mineral across the board, and zinc is the number one mineral we use to bring that sodium down. So that sodium I was talking about, 200s, 300s, whatever, that's a zinc indicator. And so I'm sure he needs zinc because of that. And then vitamin A, which could be in more of what he ate or what they would have eaten. They had more vitamin A availability in what they ate and not in what he's getting
What would
now.
be like a protein that has vitamin A or anything?
Well, you're going to get that more from real vegetables.
Okay.
Yeah,
Because I just did a podcast with the authors of The Dog's Table, which I talked about a couple times. And one thing that they told me is they said a lot of dogs lack zinc. And so they said the best way that they have found to give dogs zinc was oyster powder or mussel powder. And they've got this proprietary blend that they've researched that has like the most it's like an organic, I think, oyster powder, and they're starting to like source it and stuff because they found it that really boosts the zinc in dogs.
Yeah, zinc's for the immune system. It's for this inflammatory cascade. Zinc just is an enzyme. So enzymes are like spark plugs. People that had old vehicles or older ones will know.
yeah.
Spark plug, it ignites and then sets a reaction. That's an enzyme. And it doesn't get destroyed in that one spark. So it's there to do it again and again and again. Now, eventually it'll wear out. But there are many enzymes in the body that help reactions get going. And zinc, just as an enzyme, is needed in over 200 reactions.
Wow.
Just as an enzyme. And that doesn't include its other factors for reproductive hormones or for the liver or the skin or the immune system or all of that. So they're right about zinc being deficient. And I would think as big as your guy is, he probably needs and I use chelated zincs, which means it's a zinc that's bound with a protein, which makes it more absorbable. For his size, I'd be thinking 50 milligrams twice a day for starters for him.
Yeah, okay.
Before we even know, just because of the skin thing. And the other thing about zinc is that if you give it on an empty stomach, it can make you nauseated. So sometimes people give zinc and then the dog upchucks and they think they couldn't tolerate
Yeah.
it, they're allergic to it or something. That's not, you just got to you got to put it in food. But there is no zinc toxicity. Like
Okay, good
all
to
of
know.
these, I've been doing this for two decades. And I've done thousands and thousands and thousands and thousands of dogs. And there is not a zinc toxicity.
Good to know.
Yes, so you're not going to make them sick
Yeah.
by giving them zinc. You're going to help so many things.
Yeah. And that's what it's been like for Burley, my dog. Oh, I thought I wore a shirt. The problem has been that a lot of the veterinarians and even a great dermatologist that I spoke with is doing what you say you don't want to do. And I agree too, because I do it behaviorally as well. I was like, I don't want to just suppress everything. I want to get to the core of
Right.
it. So that way, because what they wanted to do is a shot seasonally. And right now I'm using it's foam that you put on the dog's skin to cleanse the bacteria or whatever to minimize the spread
Yeah.
of the dermatitis. So that's something that they recommended so a lot of people have to do that. They have skin issues with their dog and they've tried everything, right? But not everything. So that's what I'm digging into is I'm working with people like you and other people to really try to figure out the core of it, the guts, the biome, and now even the supplementation of the follicle. And I began doing the FMT, which is crazy because when you start looking at the FMT, and they send you a pill bottle, and on the back the ingredients are dog feces. You're like, what am I doing here?
Well, that don't bother them. They'll eat out of a cat litter box. Or,
Yeah, I know.
Yeah.
I know. It's just interesting.
So basically, dogs are designed to be able to, they're designed to eat feces. Now, they're designed to eat herbivorous feces because that has B vitamins in it.
Yeah, it has the vitamins. Yeah,
And so they will eat those should be just like deer or rabbit.
rabbit poop.
Yes, to get their B vitamins, so they're fixing they're balancing the nutrients they
Yep.
need. So dogs then have this innate program. Now they don't know that that's what it is. They're just driven towards it. I mean, like, how does the baby puppy know to go to a nipple, or any baby? That's
Right.
just part of life's innateness. So they're driven now that I need B vitamins. They don't know that's what they need, but I need what that is. I got to go find that. Well, if they don't have rabbit or deer around, they're going to go eat something that's like that. So it ends up being the other dog's poop in the yard or the cat turds in the box, nasty, but it doesn't bother the dog. They think they're, it's just fine. But they're really doing that to fulfill a lack that they have, not because it's a game that they really like playing.
Yeah.
Now, once it becomes a habit, sometimes it can be hard to break.
I had a friend that. So it's like a lot of dog owners who come to us and say like their dog is eating rocks and pebbles and stuff. I always tell them it could be just a weird thing, but I always tell them it could be a deficiency too.
Yes, that's right.
I was like, because think about it. Like a dog, rocks don't taste good, and they're not.
But they're minerals.
Yeah, so I was like, I always tell people like that's the first line of defense is
Exactly.
look for a deficiency.
Yes.
Like my friend had, like one time my friend Allie she was vegan for a long time, and then she got what they call pica, which I'm not super familiar with, but essentially what she was telling me is like a lot of pregnant women get it as well, or postpartum or something with that with birth with women, and so one of the things that she was telling me was that she was vegan for a long time, and then she just had this crazy urge to eat a burger. Like she saw her husband eating a burger, and she was just like, she's been vegan, I don't know, for like 10 years or something crazy like that. And she was just saying like, it just overwhelmed her. She's like, I need this. Because I guess pica, what women will do is they have an urge to eat dirt. Like they go vegan or even vegetarian for a long period of time, and then they have this innate primal instinct to eat dirt because their body is saying like, yo, you are deficient. And
right.
so she remembers specifically, she was sitting there, she was watching her husband eat this like juicy burger, which normally would be a huge turnoff for a vegan, obviously, right?
Yeah.
And her body was like, I need that in my mouth right now. And then ever since then, she's not a vegan, but dogs are the same way.
Right. Yeah, anytime they're digging in, eating bark, dirt, the rocks, they're digging someplace where they hadn't been, you let them out and they shoot over to that spot. And yeah, they've got some mineral deficiencies.
It's so interesting. They do the same thing with like, it's interesting about the rabbit poop and stuff because that happens all the time, like this innate.
Yeah, yeah. I go. That's fine. Go, cat. Go ahead. Go
Yeah.
get that one.
Yeah, until they puke
Just
it up.
stay out. Just stay
Until
out
they
the
puke
cat
it up in your bed like a cat. Yes, my cat's a savage. I always tell this story almost on every podcast because I find it fascinating. My cat was addicted to Friskies, and like just only ate Friskies,
Oh,
right?
yeah.
So basically, food colored corn.
Yeah.
And
Junkie.
yeah, just junk food, right? It's like me eating Doritos every day.
Yeah.
Tastes good.
Yeah.
Cool Ranch.
Yeah.
But then all of a sudden, I switched him to raw food after I switched my dogs to unprocessed food, and he turned his nose up to it for about a week, almost a week, and then he just didn't eat for like 5 days. I was like, I might have to give this up. And then like the 5th day he ate, and then he became a savage. Like he turned into this. I'm not even exact. Like even to this day, he's 15, almost 16 years old, and to this day, last night we were batting him off the counter eating pizza. He just would he'll drag a whole steak off the plate for like something switched in his head. He was eating this corn dyed Friskies.
Yeah.
Started feeding him raw, like these little raw nuggets.
Good for you.
And ever since then, he's been trying to steal the food off your table. Like we can't, like I have my No Bad Dog nubs, which are organic beef liver. I can't even leave a bag of that out. He'll tear the whole bag open and eat the whole thing. And you just wake up and he's just sitting there like, basically deceased. But I've never, like, I tell this story to everybody because it's just, it's funny, but B, it's like so fascinating to me that the moment I started feeding him like a raw diet, and that's a complete raw diet, so I had bones, organs, and regular meat tissue, he went into like my kids, like if my 3-year-old has to go potty and I'm feeding him breakfast, I have to put his plate in the microwave and shut the microwave and bring him potty to come back, because if not, he'll drink your milk, he'll eat your eggs, he'll eat your sausage, just like that. It changed. It was wild. I don't know what happened to him, but the raw food turned him into some sort of wild beast.
Yeah, he's gonna outlive them all.
100%. He's like I said. He's like my nieces were over last night, and they were like, "How old is he?" I'm like, "He's damn near 16 years old." And he like last night, they're like, "He's eating the pizza. He's dragging a slice of cheese pizza off the plate. He's like gnawing at it, and then he jumps off the ground because he's trying to run from us, and he can't run off with it because he's a small little cat. And then the dogs are chasing him because he's got the pizza, and it's just a shit show. All right, cool.
That's pretty good.
Listen, I appreciate you coming on. This has been unbelievable. I am blown away. You're an amazing person, and you've done so much. And again, like when I have guests on, I do my research on what you've done, and I try to get different people from different strokes, different folks type thing to diversify it so I can learn. And I didn't know how much stuff you were into, so I have a feeling, hopefully we can get you back on. At the very least, we can call over the phone and talk about my dog's tests.
Yeah.
Once it comes in.
Yeah, we could do that.
What can you plug for people who are listening? Your website, social media, books. What do you got?
Okay, so website, you can go to avafrick.com. That's my clinic website, and that'll get you into, I do telehealth, and there's a lot I can do helpful.
Awesome.
Through there, I see all different kinds of conditions that I can work with, the allergies, the livers, the kidneys, or whatever it is. Behavior things from a nutritional perspective. We can do that for all of those. Let's see, as far as I have exercise, it's on flash drives now. They were on the CDs, DVDs, but now I got them to flash drives. Not into the downloading things so much, but at any rate, so I got flash drives. If anybody wants a whole exercise program, they're available. I have it for dogs and then also for horses.
That's for the chiropractic movements and stuff like that.
For doing just general body exercise programs for different body zones, And then I do have a biography. It's called Conversations with Animals, from farm girl to pioneering veterinarian. So that was published in 2019, December 2019. So if you want to, read my story and see about life, and I called it that because the biographer did my story, but I told him it wasn't going to be about me. It's really about my life with animals and about how much they tell us if you spend the time to learn. Like I grew up with the cats in the barn because it was the best place for me to be, and observed all of their behaviors and what was normal and the different colored ones and all of that. And so I carried that through my whole life, and all of my patients is like, what are they really communicating? And understanding, watching and paying attention to those little things. So it's all about that. And then there's some little antics of things that happened along the way, and some funny animal stories, and some touching animal stories, and then some stories from clients about what happened with them. So that's out there for them. And then my Clinical Animal Nutrition Academy for those who have education in the field somewhat already. You don't have to be a veterinarian, but you have to have some kind of a science medical background. And then that academy it's CAN, so canutritionacademy.com if anybody wants to take a look at that. If they really want to learn more about what I've explained here and they want to do that as part of their business, they want to help more animals this way, that's what that's about. I got to the point where I realized as I was getting older and all them hours I'd spent studying all of this, that if I didn't put it out in a platform in a way that others could benefit from it so that more can treat more animals, then a lot of that time that I spent those decades was wasted if I only kept it to myself.
That's right.
I could have been out riding horses or going dancing. I love country western dancing.
Cool.
Could have been doing something else than just sitting there studying, trying to save more lives. So this is the way. This is kind of my last thing is getting around the world people educated on all of this that I've shared with you today so that they can pass it on to more animal owners and
Incredible.
more animals.
Thank you so much. I appreciate it. Bye, everybody. Thank you for listening and watching. I'll put all your stuff in the show notes if people are interested.
Thanks, Tom.
again. Yeah, I appreciate it.
You're
This
a
is
cool
great.
guy. It was a lot of fun.
Thanks. Yeah, I try. Thank you very much.